네, 잠시 안내 말씀드리겠습니다. 이제 곧 제3회 한아세안 감염병 국제 컨퍼런스가 2시 30분부터 진행이 될 예정입니다. 참가자 여러분께서는 행사장 안으로 입장하셔서 자리에 착석해 주시기 바라겠습니다. 이번 컨퍼런스는 온오프라인으로 동시에 진행이 됩니다. 질병관리청 공식 유튜브 채널 아프지마 TV를 통해서 함께 시청하실 수 있습니다. 또한 원활한 행사 진행을 위해서 소지하고 계신 휴대전화나 모든 전자기기를 매너 모드로 설정해 주시기 바라겠습니다. 아울러 통역이 필요하실 경우 자리에 놓인 리시버를 활용해 주시기 바라겠습니다. 먼저 이어폰을 꼽으시고 가운데 전원 버튼을 눌러 주시기 바라겠습니다. 리시버가 자리에 없을 경우 등록 데스크에서 받아가시길 바라겠습니다. 행사가 종료된 후에는 해당 자리에 두고 가시면 됩니다. 채널 1번은 한국어, 2번은 영어입니다. Ladies and gentlemen, may I have your attention, please? The third ASEAN-ROK International Conference on Response to Infectious Diseases 2024 is about to begin at 2:30. We kindly ask all participants to please proceed inside and take your seats. Now, today's event will be streaming live through the official YouTube channel of KDCA. And furthermore, as a favor to all, please switch on your mobile phones onto silent mode for smooth process. Also, simultaneous interpretation service is provided throughout today's event, so please tune into Channel 1 for Korean and Channel 2 for English. Thank you very much for your cooperation. 이어서 추가 안내 말씀드리겠습니다. 현재 많은 인원이 현장에 참석하고 계십니다. 감염병 예방을 위하여 기침, 두통, 발열이 있으신 분들께서는 독립된 공간에서 유튜브를 통해 참석해 주시고 또 부득이한 경우 마스크를 착용할 것을 요청드립니다. 또한 긴급 상황이 발생할 시 행사장에 진출일로를 이용하셔서 대피해 주시기 바라겠습니다. 한 번에 몰릴 경우 사고의 위험이 있으므로 안전관리 요원의 안내에 따라 안전하게 대피해 주시기 바라겠습니다. 고맙습니다. 네, 잠시 안내 말씀드리겠습니다. 이제 곧 제3회 한 아세안 감염병 국제 컨퍼런스가 2시 30분부터 시작이 될 예정입니다. 참가자 여러분께서는 행사장 안으로 입장하셔서 자리에 착석해 주시기 바라겠습니다. 이번 행사는 온 오프라인으로 동시 진행이 됩니다. 질병관리청 공식 유튜브 채널 아프지마 TV를 통해서 함께 시청하실 수 있습니다. 또한 원활한 행사 진행을 위해서 소지하고 계신 휴대전화나 모든 전자기기를 매너 모드로 설정해 주시기 바라겠습니다. 아울러 통역이 필요하실 경우 자리에 놓인 리시버를 활용해 주시기 바라겠습니다. 먼저 이어폰을 꼽으시고 가운데 전원 버튼을 눌러 주시기 바라겠습니다. 리시버가 없을 경우 저희 등록 데스크에서 받아가시길 바라며 행사가 종료된 후에는 해당 자리에 두고 가시면 되겠습니다. 1번은 한국어, 2번은 영어 채널입니다. Ladies and gentlemen, may I have your attention, please? The third ASEAN-ROK International Conference on Response to Infectious Diseases 2024 is about to begin at 2:30. We kindly ask all participants to please proceed inside and take your seats. Now, today's event will be streaming live through the official YouTube channel of KDCA. And furthermore, as a favor to all, please switch on your mobile phones onto silent mode for smooth process. Also, simultaneous interpretation service is provided throughout today's event, so please tune into channel 1 for Korean and channel 2 for English. 이어서 추가 안내 말씀드리겠습니다. 오늘 많은 인원이 현장에 참석하고 계십니다. 감염병 예방을 위하여 기침, 두통, 발열이 있으신 분들께서는 독립된 공간에서 유튜브를 통해 참석해 주시고 또 부득이한 경우 마스크를 착용 요청을 드리겠습니다. 또한 긴급 상황이 발생할 시 행사장의 진출로를 이용하셔서 대피해 주시기 바라겠습니다. 한 번에 몰릴 경우 사고의 위험이 있으므로 안전관리 요원의 안내에 따라 안전하게 대피해 주시기 바라겠습니다. 고맙습니다. 네, 먼저 인사드리겠습니다.
Good
여러분,
afternoon, ladies
안녕하십니까?
and gentlemen.
제3회 한 아세안
I am
감염병
the
국제 컨퍼런스
MC
오신 여러분
for the third
진심으로
ASEAN-ROK
환영합니다.
International Conference and response to
Ladies and
infectious
gentlemen, a
diseases
very pleasant
2024, and I
afternoon
would
to you
like to
all,
extend my
and
warmest
welcome to the
welcome to
third
you.
ASEAN-ROK International Conference on Response to Infectious Diseases 2024. My name is Kelly Park, and it is with great honor and great pleasure to be guiding you throughout today's proceedings. 오늘 이 뜻깊은 자리 여러분과 함께하게 된 켈리 박입니다. 반갑습니다. 네, 고맙습니다. 먼저 바쁘신 와중에도 귀한 시간 내주시고 함께 현장을 참석해 주신
First of all, I would like to thank everyone for joining us despite their busy schedules. We have many participants joining us here at the venue.
오늘 컨퍼런스는 현재
Today's conference is being broadcasted live on the KDCA official YouTube channel. So there are many of you joining us online, and so I would like to also extend my warmest welcome to all of you. As I mentioned before, today's conference is being provided with simultaneous interpretation. For those of you who need simultaneous interpretation, please turn to channel 1 for Korean and channel 2 for English on your receivers.
Before we begin, please note that simultaneous interpretation service is provided throughout today's event. So please tune into channel 1 for Korean and channel 2 for English. 올해 2024년 컨퍼런스는
The 2024 conference is being held under the theme Climate Change and Infectious Diseases Addressing Global Health Threats. We will present infectious disease-related strategies and challenges in responding to climate crisis. We will share insights and discuss ways to strengthen the cooperation between ROK and the ASEAN member states to jointly respond to the climate crisis. We hope you will stay with us till the end, and we hope that the conference will be professionally rewarding and enjoyable to all of you. And now, with that said, let us begin the 2024 ASEAN-ROK International Conference on Response of Infectious Diseases.
네, 그럼 첫 번째 순서로 지영미 질병관리청장님께서
Now we will
이번 컨퍼런스
have
취지를
the
알리는
video
통해
speech
본격적인
by
말을 열어주시겠습니다. 청장님께서는
지영미,
국정감사 종합감사를
President
인하여
of
불가피하게
KDCA,
참석하지
although she
못하셨는데요.
cannot
이에
present
양해
herself because
말씀드리며
of
영상으로
the
함께
National
해주시겠습니다.
Assembly's audit. She
통해서
kindly sent us a video
하겠습니다.
to welcome
Please
you
join me
all.
in
Why
welcoming
don't we
지영미,
join
Commissioner
us
of
to
Korea
give
Disease
her a big
Control and
hand for
Prevention
the
Agency.
speech.
Please welcome with a big round of applause.
Good afternoon, colleagues, distinguished guests, ladies and gentlemen. I'm Young-mi Ji, Commissioner of the Korea Disease Control and Prevention Agency. My apologies for not being able to join you in person. Still, it is my privilege to send a pre-recorded message for the 2024 ASEAN-Korea International Conference on Response to Infectious Diseases, hosted by Korea DCA and ASEAN Secretariat. First of all, I'd like to express my sincere gratitude to Dr. Gao Kim Hon, Secretary General of ASEAN, and Ms. Kumju Bae for the partnership to co-host and support this session. I also want to convey my deepest appreciation to Professor Ho Kim, the President of the Korean Society of Climate Change Research, and Dr. Rok-ho Kim, Senior Advisor of the WHO Asia Pacific Center for Environment and Health, for accepting the keynote speeches, and all speakers and chairpersons for their valuable contribution to this conference. My special thanks go to the 13 participants of the second GISCO Code Personnel Training Program for joining us today, and Kohi for the great support in organizing this conference. Korea DCA continuously strengthened international collaboration, and especially with launching its own ODA project tailored to the needs of the global community and establishing the Global Health Security Coordination Office, GISCO, in 2023. Since ASEAN is a key partner for strengthening global health security, Korea DCA initiated ASEAN-Korea Cooperation Project on capacity building for infectious disease to enhance response capacity of the region in 2022. This year, Korea DCA also started the core personnel training program, providing intensive hands-on training to core public health representatives from ASEAN member states in the areas of laboratory diagnosis and analysis, biosafety, and vector surveillance as a part of the GISCO project. In this regard, I am very pleased to highlight that first training was successfully completed with 7 public health officers from 4 countries in June this year. In addition, 13 personnel from 7 member states are now participating in the second program for 2 weeks in October in connection with today's conference. The Korea DCA will further expand the areas of capacity building program, leveraging the agency's expertise to contribute to strengthening regional and global health security and enhancing joint response capabilities in preparation for future public health threats across a broader range of countries and regions. We are all aware of the critical challenges posed by climate change and its impact on emergence of infectious diseases. This impact will exacerbate social and economic burdens and have direct and indirect consequences on both physical and mental health. This year, Korea DCA has established mid- and long-term plan for climate change and health 2024 to 2028, recognizing that climate change is one of key public health threats. This 5-year plan focuses on minimizing public health hazard and enhancing climate resilience through effective surveillance and preparedness for and response to climate crisis. I believe today's conference will serve as a vital platform where participants will gain invaluable insights and share innovative ideas to address current and future health threats posed by climate crisis. This conference will also function as a pivotal point to build stronger partnership between the KDCA and ASEAN in a shared commitment to advancing health security and fostering global efforts to mitigating the effect of climate change. Once again, I'd like to extend my sincere gratitude to all speakers, panelists, participants, and everyone involved in this meeting. I wish you a very productive and successful conference. Thank you.
네, 큰 박수 부탁드리겠습니다. 질병관리청장님의 좋은
So thank you
말씀 잘
very much for your
들었습니다.
meaningful
오늘
words. That
함께해
was
주신 모든
Ji Young-mi, the
분들께
Commissioner of the
더불어
Korea Disease
앞으로
Control
한아세안
and
협력을
Prevention
위한
Agencies.
컨퍼런스의 비전과
And
방향을
we
제시해
hope
주셨고요.
that
또 오늘
we'll be
논의를
able to
통해서
continue
기후
to share the
변화와도
vision and the
가급적 도움에
direction for
큰
ASEAN-ROK
성과를 이루기를
international
기대합니다. 자,
cooperation.
그럼
And we hope
계속해서
that this year's
환영사를
conference
청해
will be
드리도록 할
productive
텐데요.
and meaningful.
부득이한 일정으로 현장에
We
함께해
would
주지
like to invite
못하셨지만
the
정말
next
많은
speaker who was
분들께서
not
오늘
able to
현장에
join
함께해
us
주신
in
모든
person,
분들을 환영해
but
주셨습니다.
has sent us a
그럼
special
먼저
video
로도란
message.
파파란
I would like to
아세안
invite
상무국
Lodoran
협력
Paparan
국장님의 영상
for her
환영사를
welcoming
함께
remarks. She is the
만나보도록
Director of
하겠습니다.
Human
Please
Development at
welcome
the
로도란
ASEAN
파파란,
Social
Director
Cultural
of
Community
ASEAN Secretariat.
Department.
Please welcome her with a big round of applause.
Excellencies, distinguished guests, colleagues, and friends. On behalf of the Secretary General of ASEAN, His Excellency Dr. Kao Kim Horn, it is my honor to deliver remarks at the 2024 ASEAN-Korea International Conference on Response to Infectious Disease. I extend my deepest gratitude to the government of the Republic of Korea for their steadfast partnership and commitment in advancing regional and global health security, including the convening of this conference. The theme of this year's conference, Climate Change and Infectious Diseases Addressing Global Health Threats, could not be more timely. As we all know, climate change is one of the defining challenges of our era, with far-reaching consequences that extend beyond the environment. Its impact on global health, including intensified spread of infectious diseases, recurrence of deadlier diseases, outbreaks, and pandemics, compounded by worsening health impacts from extreme weather events, among others, demands our urgent attention and action. Excellencies and colleagues, the health-climate nexus has increasingly become evident and recently gained prominence in global discourses on climate change, which is considered the greatest threat to human lives, health, livelihoods, and well-being in the 21st century. rising global temperatures, shifting weather patterns, and extreme climate events have been shown to alter the habitats of vectors-borne diseases, leading to the spread of vectors-borne transmitted diseases such as dengue, malaria, and Zika to regions that were previously unaffected. Changes in rainfall and flooding patterns also contribute to outbreaks of waterborne diseases like cholera and leptospirosis. In addition, the COVID-19 pandemic has demonstrated that infectious diseases disrupt societies and economies on an unprecedented scale. The need to strengthen health systems, enhance surveillance capacities, and foster regional cooperation, among others, have never been more critical. The ASEAN member states and the ASEAN are committed in gearing up our systems and capacities through sustained regional health security strengthening efforts. The ASEAN, together with partners such as Republic of Korea, has made significant strides in building a resilient health system. Our regional frameworks and mechanisms, such as the ASEAN Emergency Operations Center or EOC network for public health emergencies, and the ASEAN Biodiaspora Virtual Center, have enabled us to collaborate more effectively in addressing health threats, including those linked to climate change. We also continue to harness multi-sectoral coordination using the One Health approach in our responses to health threats and crises, including climate change, which impacts cut across various sectors and thereby requires cross-collaboration across health, environment, agriculture, animal health, disaster management, or social welfare, among others. Excellencies and colleagues, at the second ASEAN Republic of Korea Health Ministers meeting held last August 2024 in Lao PDR, Korea and ASEAN health ministers declared their shared commitment to pursue transforming ASEAN health development resilience in the new context with a focus on digital transformation in healthcare. The ASEAN and ROK committed to take a concrete, step-by-step approach to improve the health of ASEAN member states, as well as the efficiency and utilization of healthcare resources by presenting a future vision and making a work plan for digital transformation. This strong cooperation between ASEAN and the ROK showcased concrete multilateral actions in advancing regional health security that will contribute to the global agenda, such as addressing climate change and its public health consequences. I wish also to highlight ROK's expertise and leadership in health innovations and infectious disease control have been invaluable to ASEAN's efforts to address these challenges. This conference provides an opportunity to deepen our cooperation, exchange knowledge, and develop new strategies to mitigate the dual threats of climate change and infectious diseases. Excellencies and colleagues, I strongly believe that by working together, we can enhance our region's resilience to health challenges that transcend borders, ensuring that our communities are better protected and prepared for the future. Let us use this platform, this conference, to strengthen our collective action against the global health impacts of climate change. Finally, I would like to once again express my deepest appreciation to our partners in Korea and to all the participants in this conference. Your contributions are important in shaping our shared goal of safeguarding public health in the face of new and emerging threats. Together, let us turn our discussions into action, building a healthier, more resilient future for all. Thank you.
네, 아세안 사무국 인력 담당 국장님의 소중한 말씀 잘 들었습니다.
So thank you very much for your meaningful words. So with regard to climate change and infectious diseases, we are looking at ways to enhance cooperation between Korea and the ASEAN member states. And so once again, we would like to thank her for sending her a message, although she couldn't join us today. Next, we would like to invite Bae Geum-ju, President of the Korea Human Resource Development Development Institute for Health and Welfare for her remarks as well. Due to national audits, she has not been able to join us in person, but she has also sent us her video.
Please welcome Bae Keum-ju, President of Korea Human Resource Development Institute for Health and Welfare. Please welcome her with a big round of applause.
안녕하십니까? 한국보건복지인재원
Ladies and gentlemen, good afternoon. I am Bae Keum-ju, President of the Korea Human Resources Development Institute for Health and Welfare. I extend a warm welcome to all the participants of the 2024 ASEAN-ROK Infectious Disease Conference. I would like to express my sincere gratitude to Commissioner Young-mi-ji of Korea Disease Control and Prevention Agency, as well as His Excellency Kao Kum-hoon, the Secretary General of the ASEAN Secretariat, for his organizing this meaningful event today. And I would also like to especially thank our keynote speakers, Dr. Rok Kim from WHO, Asia Pacific Center for Environment and Health in the Western Pacific region, as well as Professor Ho Kim from Seoul National University. In addition, I would like to express my gratitude to all the domestic and international presenters and attendees. The topic we would like to discuss today is climate change and infectious diseases. Climate change is no longer just a change in the environment, but it is becoming a serious problem threatening our health as well as our survival. It is promoting the outbreak and spread of infectious diseases in various ways and is demanding innovation in our public health system and infectious diseases response system. I hope this conference will serve as an opportunity for Korea and ASEAN member states to effectively cooperate in responding to climate change and infectious diseases and to prepare for the future. Since 2022, KOI has been entrusted with KDCA's capacity building project and has been promoting the ASEAN Health Cooperation Project to respond to infectious diseases. In addition, we have conducted training for ASEAN health experts and public officials every year, serving as a platform for continued cooperation and interaction between Korean and ASEAN experts. We hope that all the ideas and strategies discussed at this conference, which is being held for the third time will serve as an important foundation for ASEAN countries and Korea to cooperate to respond to climate change and prevent infectious diseases. We encourage your active participation and contribution to the conference. Thank you.
Thank
you very much. That was Bae Keum-ju. With that welcoming speech, we are now reminded of the importance of this event. And also, with the presence of the experts here, we are all committed to solving the issues of the infectious diseases in these areas. Thank you very much once again. Before we begin our main point of the event, we'd like to have some arrangement of the stage and also the group photo taking session. We'd like to invite all the VIPs from KDCA, ASEAN, KOI, and our honorable speakers and panels. Please come to the stage.
So would all the officials from KDCA, KOHI, and our honorable speakers and panelists please proceed up to the stage for the group photo. 네, 이제 기념 촬영 시간을 가질 텐데요. 저희 촬영 마치고 바로 이어서 프로그램 이어가도록 하겠습니다.
Yes, after this group photo taking session, we will continue our session with the first presentation. Please be patient just a little bit. Thank you very much for your cooperation. Now I'd like to ask all the people standing on the first row. And we will have two shots. First of all, please smile to face the camera person. Thank you. 1, 2, 3. And then why don't we just have our resolving gesture with the hands, the fist up, please.
Thank you very much for your
Please join me in
cooperation
giving
and
them a
support.
big
다시
hand.
자리로 모시도록 하겠습니다. 다시 한번 오늘 이 소중하고도 의미 있는 자리 함께해 주신 내외 기빈
Once again, I'd like to express my gratitude to all the people who have given us the great presence today to grace this event. We will have the presentations as well as the panel discussions at the end of the day. I really appreciate your undivided attention throughout the day. With that, we'd like to now give you the starting of our conference. Our first presenter is Professor Kim Ho of Seoul National University Graduate School of Public Health. He will be speaking about the climate change and infectious diseases in Korea, overview and case studies. Let me now give also the introduction of Professor Kim Ho.
Now, Professor Kim has the PhD in biostatistics at University of North Carolina at Chapel Hill, USA, with experience as professor of Seoul National University at Graduate School of Public Health and also the Dean of Graduate School of Public Health at SNU. So, ladies and gentlemen, please welcome Professor Kim of the Seoul National University with a big round of applause. 여러분 큰 박수로 환영해 주시기 바라겠습니다.
Please welcome him with a big round of applause.
Good afternoon, everybody. I'm very happy and honored to have a chance this opportunity, and thanks for the organizer for organizing this wonderful event, and especially my welcome to the international colleagues to fight for climate change and protect our health. Okay. So this is modified version of WHO's diagram from the direct from climate change to the human health. There are many complicated networks, including vulnerability factors, exposures, and health systems. As we all know that especially in the East Asian countries, including Korea, we are experiencing rapid aging problems. So the vulnerability factors, I don't think we have a very good situation. I'm a little bit have a big worry on the vulnerability, mainly due to the aging factors, and the exposure side, we have more and more heat wave days, and rainfall is also a problem, drought. So direct exposure side, this is not good also. And many of us know that the Korea is now experiencing kind of debate between medical doctors and government on the health system. So health system, I don't think we have a good situation also. So all of these combining threats, we will probably have more problems on health related to climate change, I think. And about the health outcome, respiratory infections and waterborne, zoonotic, and vector-borne, and other diseases, the truth is that we human beings has very little understanding of the complexity of these problems. So we have to admit that our knowledge is limited, and not all biological. It has something to do with all social problems and economics and everything. So the problem is very complicated. And from the causes, like environmental and epidemiological challenges, bottom to the infectious diseases, there are several points we can intervene. Basically, we have to mitigate and conserve our environment. But that kind of plan will take long time, and it takes long time to see the actual effect. So even though we try best for that kind of things, but in the meantime, we can do several things for the better adaptation and preparedness, which is the short-term goal of our healthcare problems. So we have to, in the short, to minimize the health burden, we have to think about how to adapt and how to prepare to minimize exposure and vulnerability. That's very important. But we need also do the basic things for the mitigation side also. So this diagram shows a lot of aspects of these problems, including getting models and accumulating data. And the projection is also very important. I will focus on the projection in the later. And then surveillance also is very important to have a valuable, valid data set also. And then the very bottom, social determinants of health is also very important. So when we talk about a vulnerable group, the social inequalities and targeting vulnerable people is also very important to maximize our plans, actually. And on the right-hand side, co-benefit and unintended consequences is also very important. Nowadays, we see more and more unintended consequences also. So whenever we are doing something, we need to think widely and think about the possible consequences in advance. That is very important. Otherwise, we will see a lot of unintended consequences, which will be very hard to cover later. So as the commissioner said, I'm currently the president of Korean Society for Climate Change Researches. And in our society, we have published, funded by MOE. This is funded by MOH, but this kind of departmental, how can I say, the collaboration is very important for all countries. So the collaboration is very important. So I'll talk about MOE or CDC's activity later, but I'd like to stress that the collaboration between other sectors are very important. In this kind of reports, the reports include all the sectors like agriculture, ecology, and forest, and everything. So we try to see the connections between each sectors. That is very important, especially in the infectious disease side. So that is something I'd like to show you. And then in this report, all the sectors, including health, has very similar structures. The observed impact, we try to provide observed impact and projected impact and vulnerability and adaptation options. So all these sectors like health or agriculture or ecology, forest, they have same format. And I will show you the result of health sector. So in the health sector, we pointed out those three very important areas related to climate change, which are heat wave, natural disaster, air quality and allergy, and vector-borne diseases and waterborne diseases. So among those six, among these five actually, last two, vector-borne and waterborne and foodborne diseases, are related to today's topic. So I will briefly introduce the contents of those reports. So the observed impact, the report pointed out that vector-borne disease like 쭈쭈가무시, leptospirosis, and malaria will increase as the temperature goes up. So that's their conclusion. So basically we did the review of the previous papers. So that's our finding throughout the report. And then waterborne and foodborne diseases like Vibrio problems and shigellosis will also increase as the temperature goes up. So that is the reporting. And not only rising temperatures, some other climate factors like precipitation. Precipitation is very hard to study, actually. The relationship is not usually linear. So today you will see nonlinear relationship a lot. So this how to deal with this nonlinearity in terms of research is also very important. So the important factors, climate factors include temperature, ocean temperature, and humidity, precipitation, salinity, and ecological environment, and human environment also, like land use or urbanization. Those are also very important factors related to infectious diseases. And for the vector-borne diseases, Tsutsugamushi disease is one of the public concern in South Korea. So the problem is that the patient number is rising every year. So I will show you the graph shortly. And then this is something to do with the human activity, outdoor activity also. But we expect that outdoor activity will be more, people try to spend their, increase their outdoor activity, of course. So we see that in the future, we have more risk in the future. So this is from Korean KCDA reporting, official reporting system. You show the number of cases is steadily increasing over years. This graph shows from 1997 to recent years. That nobody can deny that number is going up. So that is our reality. And probably this number will not go down soon. That's the problem. And mosquito-borne diseases like malaria or Japanese encephalitis and other diseases like dengue fever and Zika virus, those are the new and emerging infectious diseases will be a problem soon. So the international collaboration is very important to control this kind of diseases, and the communicating with the other countries, especially neighboring countries, is also very important, I think. So let me talk about the Korean KCDA's approach. They have a very good reporting system, and the journal called Public Health Weekly Reports. So you can download very good data, weekly report over there. So you can see the link site over there. So and this and they also have very good reports over there. So this table shows the malaria patient by year from 2014 to 2023. So you can see the number is steadily going up. Malaria is a big problem in South Korea currently. And so they have a national plan to eliminate this problem by year 2030. So this is very good report, how the government is preparing, and written in English. So you can check that report over there. And this diagram shows the difficulty of malaria control. So in the old days, before 1970, we have a lot of patients, but it was eliminated. Number of patients were 0 for more than 10 years between 80 and 90. But by some reason, we see the increasing number of patients, and we believe that that is the influence from North Korea. So the problem began on the border area with North Korea, and then after the retirement of the soldiers, after ending their duty, they went back to their home country. So when you see the map, all the cases spread along the border side, but suddenly you see some other sides. That's because of the retired soldiers, actually. So that was the problem. But recently, you see it went down, but recently you see the number of cases are going up again, right? And then I believe that this year, I don't check that number of this year, but it is more than the previous years, I think. So this is current problem, and then government is doing their best to eliminate until 2030. That is the most significant problem related to climate change and infectious diseases, I think. And basically the problem in terms of ecology is that transmission period is expanding. So currently, people think that malaria transmission is possible for 4 to 6 months in South Korea. But due to the climate change and warmer temperature, it is expected to extend to 4 to 6 months in both South and North Korea, actually. So that means that the weather is becoming more friendly in spreading this disease and for the mosquitoes, actually. So condition is more friendly and to spread these diseases also. So this is very hard to control. We cannot control the weather itself or climate itself. So that we need to minimize these health hazard. We need to do something else, right? And re-emerging diseases, as I told before, this is also an issue. We should always be aware to watch out this kind of information internationally. And then the Korea is experiencing very rapid aging problems. It is getting serious and serious. So how to protect the vulnerable group, including elderly people, in rural area. Rural area means they have more exposure to outdoor activities and more mosquito activities, something like that. And so how to protect them is another big issue over there. Okay, for the last part, I will show you 2 case studies our groups have done recently. This is the joint work with WHO funded activity, actually, and joint work with Japanese researcher group in modeling the dengue incidence in Lao PDR. So in this, the reason I show you is that this kind of modeling approach requires less laboratory works, and getting data is enough to do this. But the challenging part in most of the developing countries is to have good quality health data, actually. But once you have this kind of information, using the up-to-date methodology, it is not very difficult to show the association between risk factors and the diseases itself. So here we collected 55,000 cases, and the timeline is weekly. So they didn't have daily data. So weekly data is the data we had, and then the local unit is the province. So it's a little bit larger area with longer time, but we could do something. So our conclusion was that we compared, for example, temperature, 29 degrees Celsius to 24 Celsius. Between those two temperature interval, our estimation was that 4.21 times higher temperature effect over 22 weeks. Sounds a little bit complicated, but because of the non-linear nature, we need 2 points for the reference to compare, and then we have to think about longer, we call lag effect. So I will explain a little bit more. So first, we need to create this kind of descriptive table. So those are the, on the first column, you see the names of the province and all the other information. So you, as this is the map of Lao PDR, and then you see the province on the left-hand side, and shows the information of disease and temperature and precipitation, weekly information, all of that. So the time and spatial resolution was not very accurate. So just number of weekly reported cases and weekly mean temperature and precipitation, that's all available. And so the first thing is to show the graph like that, geographical distribution, as well as time pattern. The second graph shows the number of cases by provinces, actually. So those are the information we had. And then we did this kind of so-called two-stage model, and shows the first graph on the left-hand side and top. You see the effect of temperature and the disease. So you see the rising risk on the higher temperature side. National, that is the average of national numbers. And then, what is that? And then the next one on the right-hand side shows the lag pattern. So the lag means that the curve goes up at maximum at week 10, roughly. So that if you have a precipitation, then you expect to have a maximum number of patients 10 weeks later. That is the, then means you can do something in, you have at least 10 weeks if you have a high precipitation. So that kind of interpretation and policy will follow. And at the bottom is the effect of rainfall, national average. You see that the highest is in the medium, about 100 millimeters. But if you have very high precipitation, the risk goes down rapidly, because the high precipitation will sweep out everything. So the mosquito has, the condition is not friendly to them. So that is typical, we call dose-response relationship. But one thing you have to remember is that this is national average. So all the province level, the curves are very different. We call heterogeneous relationship, which shows on the right-hand side. For the rainfall effect, the blue one is national average, but each province shows very different effect. So you have to remember that this kind of national average is just an average of those province level effects. So that is the difficulty of how to handle the heterogeneity for different regions. Okay, and the second study was conducted by our student, PhD candidate, who is sitting somewhere over there. and in this, this is Korean study, Chichagamushi study. So in this case, we have collected much better spatial resolution, as you see the graph over there. And we also have weekly reports. Because if we reduce the time resolution to daily, then the daily count is not big enough. So we lose our statistical power. So we had to add them up into 1 week to have better statistical power. So similarly, we have a time series plot and the geographical information also. And this is the conclusion. Pooled estimate, as I said, all the different regions have different shapes, but we pool them into one graph, shows temperature. So in this picture, you can see that the highest risk around 20 degrees, and then it goes down for very high temperature and very low temperature. And see the similar pattern for the precipitation, okay? And we try to draw that relationship for different values of other factors like greenness or rural-urban differences, but we just couldn't find that the risks are very different from. My time is almost up. So this is the last slide. For this area, we have very limited knowledge as a human being, as a scientist. So more researches should be conducted to find out related diseases and factors and to find out vulnerable groups. And doing this integrated approach, like One Health or Planet Health scheme, is very important, especially in the infectious disease area. And we should strengthen monitoring system. I think Korea has a very good example for several diseases already. And how to communicate with agencies and people is also very important because the people is expected to avoid the risk, well-known risks. Avoiding that risk is also a very challenging problem as a public health researcher. And collaboration between sectors, as I said, ministries of health and environment is very crucial to protect people's health. And projection is also very important. So the importance of projection is that you can have different numbers depending on the different plans or activities. So accurate projection will give you very good sound of current choice of plans. If you have more than 2 choices, then you will have different projections. Then if you compare, then it is much reasonable to have better choices today. So that is the importance of projection also. Okay, this is it for today. Thank you.
네, 김호 교수님의 기조가견 잘 들었습니다.
Thank you very much, Dr. Kim Ho. And you have given us the good examples of the impact on the Korean climate through your case studies, and they've been very detailed to understand. And also what kind of plans should be made for the infectious diseases, and that gave us a good insight on what to do. Thank you very much.
The next presentation will be delivered by Dr. Lokho Kim, Senior Advisor of the WHO Asia Pacific Center for Environment and Health. Dr. Kim will be delivering a presentation titled Climate Change and Infectious Diseases, Evidence and Policy. Please allow me to introduce him.
I would like to briefly introduce Dr. Kim's profile. Now, Dr. Kim has a PhD in Harvard University Boston of USA with experience of medical director of Sadang Clinic and Green Hospital and also the assistant professor at the Seoul National University. 네, 자문관님께서는 오늘 온라인으로 함께 참석을
Today he is going to
해주셨는데요.
join us
등록해 주시면
virtually.
자문관님을 화면으로
So please
만나보도록
welcome
하겠습니다.
Dr. Kim. He is on the
Senior
screen.
Advisor of the HWO Asia Pacific Center for Environment and Health. Please welcome with a big round of applause. 네, 자문관님 안녕하세요.
So hello.
잘 들리시나요?
Can you hear me? Yes, it's a pleasure to meet you. Yes, I can hear you. That's wonderful. So if you could please now deliver your keynote speech. Thank you very much.
Good afternoon, everyone. It's my great pleasure to give a keynote speech at this important international conference on response to infectious disease with ROK ASEAN partnership. Let me show the slide. Okay. I hope you see the slide now. Okay. So today I'm going to talk about climate change and infectious disease, focusing on the importance of evidence generation and policy making and also resource mobilization. I'm currently working as a senior advisor for the Asia Pacific Center for Environmental Health based in Seoul. So I'll start introducing the center and then provide a very brief overview of climate change and health, even though already Professor Ho Kim provided a lot of information based on Korean experience. And then a bit more about infectious diseases and climate change and what WHO recommends for Asian countries, particularly building climate resilient health systems and mobilizing resources for that. So what is Asia Pacific Center for Environmental Health? It is a geographically dispersed specialized office of Western Pacific Regional Office of WHO, which was established in 2019 with the support of Korean Ministry of Environment and Seoul Metropolitan Government. It has 4 areas of work: climate change and health, which is a topic today, air quality, energy and health, living environment, and water sanitation and hygiene. Basically, the center intends to strengthen scientific information and evidence for policymaking on existing and emerging climate change and environmental determinants of health, and provide technical support to member states and also provide advocacy for climate environmental health. Climate change is one of the top priorities of WHO. The new general program of work, which is the number 14th general program of work, covering until 2029, noted that the pace of climate change and environmental degradation has accelerated, emerging as a major threat to human health in the 21st century. So WHO focuses on adapting health systems to climate impacts, mitigating environmental health risks, and strengthening global health securities. So WHO commits to tackling the health implications of climate change, particularly in vulnerable regions like the ASEAN countries. So what is the connection between climate change and infectious disease? I don't need to go in detail because already Professor Ho Kim provided excellent overview and very good examples from Korean researches. But just as a reminder, climate change has impacts in three areas: rising temperature, sea level rise, and extreme weather events. All these three impacts have implication on change of infectious disease patterns. Rising temperature, already the world is seeing 1.5 degree higher world as compared to 100 years ago. And kind of a projection of status quo, business as usual, predicts 4.8 degree higher by 2100. It's very bad news. Also, sea level rise currently is increasing 1 to 3 millimeters per year globally on average. But in ASEAN region, this increase is higher than other coastal areas. So projection is like between 50 centimeter and 1 meter sea level higher than 100 years ago by 2100. That is very bad news for coastal areas, like in many Asian ASEAN communities. Also, extreme weather events. IPCC, Intergovernmental Panel on Climate Change, the most authoritative scientific institution on climate change, predicts that the ASEAN region will experience the longer and more intense monsoon seasons, increased frequency of droughts, and more intense tropical cyclones. As we know, ASEAN region has a quite dense population, also high levels of heat exposure already, and there is a seasonal risk of concurrent flooding and drought incident. So these three factors make ASEAN region more vulnerable to the impacts of climate change. So how this climate change impacts on human health? According to WHO study, only counting the obvious impact of climate change on health, like childhood malnutrition, malaria, diarrhea, and heat exposure, about 250,000 deaths will be added between 2030 and 2050. Please note that this WHO report counted only the obvious and proven link between climate change and some health outcomes. So if we include more indirect impacts, this number could be much higher. As Professor Ho Kim already showed, WHO summarized the relationship between climate change and health outcomes and health systems in one slide like this. So between climate change and the ultimate outcomes, there are factors which mediate and adjust the potential impacts. So they are vulnerability factors, demographic, geographic, biological factors, socio-political, socio-economic, health system capacity, and gender equity composition. Yeah, these are vulnerability factors. And as I mentioned just now, ASEAN countries have high vulnerability to climate risks. Also, kind of exposure, extreme weather events, heat, sea level rise, air pollution, vector distribution and ecology, water scarcity, or reduced food production. These are climate-related hazards which compose the exposure pathways. And direct exposure is mediated by the health system, of course. So there's people and communities, health workforce, as many of you are responsible in your country, infrastructure, health infrastructure, and also energy system, water system, food system, health systems. All these kind of capacity of the country to deal with this system, this impact. So some countries have quite a strong capacity and very limited vulnerability, while many low-income and middle-income countries have very high vulnerability and exposure and very fragile health systems. So what is the impact on infectious disease transmission? Again, Professor Ho Kim covered so well, so I don't think I need to repeat. Just as a reminder, malaria transmission is now happening in many high altitude and latitude areas, like Korea experienced. So clearly, climate change made malaria reappearing in many areas that had seen elimination many decades ago. Also, high temperatures can extend the geographical range and season length for disease vectors, as mentioned by Professor Ho Kim. And also, heavy rain and temperature will increase the risk of diarrheal disease, dengue fever, and malaria. And extreme precipitation events can lead to flooding, increased risk of waterborne diseases. Dengue is becoming a major infectious disease problem related to climate change. And according to a recent study, there was almost 10% increase of dengue vector as compared to 100 years ago. So rising temperature increase pathogen replication rate and shorten incubation period. And altered rainfall patterns affect the vector breeding sites and survival rates. Overall, altering ecosystems potentially lead to new human-animal pathogen interactions and increased zoonotic disease risks. This is an important point for the risk of future pandemic. So climate change may increase the potential risk of future pandemic originating from zoonotic disease. Let's not forget another impact of climate change on health systems. Climate change does not only increase infectious disease and other health outcomes, but also damages and destroys health facilities, as you have seen here, one from Bangladesh, one from Fiji. After heavy typhoon and cyclone, countries are losing their precious health facilities like this. Then, what is WHO's guidance? What member states can do to respond to global health threat, climate crisis? WHO adopts health systems approach. So rather than introducing fragmented silo approach, WHO advised to strengthen the whole system. So WHO has been promoting so-called operational framework for building climate resilient health systems for many years. And last year, WHO renewed the previous operational framework to include low carbon and environmentally sustainable health systems as well. So this diagram summarizes WHO's climate resilient health system building scheme. Basically, as many of you already know, WHO adopted 6 pillars of health system. That is, they are leadership and governance, health workforce, health information system, essential medical products and technologies, service delivery, and financing. WHO recommends to build climate resilience in each of these pillars. particularly health information system and service delivery. I don't need to go into detail, as you can easily find references, resources, and tools in WHO website if you Google climate resilient health system. So WHO recently expanded this concept to apply to health facilities so that countries can use this frame in assessing the preparedness of health facilities, their hospitals, community health centers, any clinics can be assessed through this frame. Basically, this frame uses 4 aspects of climate resilience. Whether the health workforce are properly trained and prepared to handle climate-related health issues. We call it climate smart health workforce. Another aspect is climate-informed health surveillance and early warning system. As Professor Ho Kim showed, there is a very strong relationship between weather patterns, weather parameters, and disease outcomes. Then disease programs can use climate or weather data already to predict the upcoming increase of climate-sensitive diseases, and then prepare for the outbreak. And that way, countries can respond to the impacts more effectively. Eventually, they can say it can save lives and many disease injuries. Also, climate resilient water and sanitation safety plans. We know that still there are many hospitals, healthcare facilities, community health centers, and healthcare facilities do not have clean water and sanitation facilities. So the situation makes it much more vulnerable to any climate impacts. So water sanitation and hygiene facilities in the healthcare facilities should be improved. And finally, climate resilient and low carbon healthcare facilities. These low carbon healthcare facilities are important in the big cities where big hospitals may consume unnecessarily high energy inefficiently. Probably in the ASEAN countries, this is less a problem because in the ASEAN countries, the population may need more advanced healthcare facilities. But this is this issue, climate resilient and low carbon healthcare facilities, is very important in developed countries where healthcare sector produce around 5% of greenhouse gas emissions of the country. So WHO produced guidance on climate resilient and environmentally sustainable healthcare facilities and provide more detail. Basically, the idea is apply the concept of climate resilient health systems to healthcare facilities, focusing on 4 aspects that I have just mentioned. So, what is the implication of climate-related infectious disease for ASEAN countries? It will increase the risk of waterborne, vector-borne, and zoonotic diseases. Also, that way, it will increase the burden of healthcare systems, burden on healthcare systems unprepared for new disease threat. Also, it may disproportionately impact on vulnerable communities, thereby worsening the health inequity. So clearly, it has very negative implications on health system and health and well-being of the population in the ASEAN countries. However, I'd like to spend a few more minutes by telling about the opportunity we have as well. This can be an opportunity to build climate resilient health systems through climate financing mechanisms. What are the climate financing mechanisms? Because climate change was not produced or caused, made by low and middle income countries. Climate change, which was caused by the fossil fuel combustion and producing carbon dioxide and other greenhouse gases into the atmosphere, started from the very rapid industrialization in the past 2 centuries. And most developed countries benefited from such industrialization. But when climate change makes an impact, low and middle income countries, which did not contribute to climate change that much, are the first victims. That's why the world established global climate financing mechanism so that developed countries can support developing countries for financial and technical assistance. So there are a few important financing mechanisms, and first one is GCF, Green Climate Fund. They provide funding for strengthening health infrastructure, and GEF, Global Environment Facility. They provide support for building resilience in health systems. And Adaptation Fund, World Bank, and Asian Development Bank, they all provide funds for adaptation and also mitigation as well. So how we can use these funds? I'd like to share an excellent success story from Lao PDR. This is a good case study, and I hope other ASEAN countries can join this example for building climate resilient health systems and resource mobilization. Basically, Lao PDR started using WHO operational framework as a systematic tool for evidence, policy, and project development. So they did vulnerability and adaptation assessment in 2018-19. And they assessed the direct impacts of flood water, injury or death, heat-related deaths among elderly people, waterborne disease, vector-borne disease, undernutrition, food security, and wash and health facilities damage, and service interpretation. And this, through the WHO operation framework, Lao PDR produced some evidence-based policies. And this vulnerability and adaptation study was used to design a project to build the resilience of health systems to climate change. It was not a big amount, but 1.5 million for 5 years was quite substantial. Basically, the project focused on leadership and governance, health workforce, health information systems, and service deliveries. I think many of you are interested what this project has done to improve the health workforce in their response, in their understanding and response to climate-related health issues. Anyway, the project applied WHO's operational framework scheme to make interventions. And then last year, Lao PDL received $28 million GCF support for strengthening climate resilience of Lao PDR's health system. This was kind of an extension or phase 2 of the JEF project. Because first JEF project was very successful, GCF financed even much larger amount to continue to build climate resilient health system. So this is a wonderful success story of an ASEAN country, Lao PDL, starting from application of WHO operational framework for vulnerability and adaptation assessment, and formulate a proposal for intervention and improvement, and access the global financing, global climate financing mechanism. So in conclusion, it is important to coordinate strategies across ASEAN nations to enhance regional resilience. So rather than working country by country, it is much more effective and efficient to work together as a region. As the Professor Hawking mentioned, these vectors and the patient move around the country border. So building only one country resilience is not always successful. And there are benefits of international cooperation, resource sharing. So medical supplies, vaccines, and funding can be shared. Knowledge exchange, just like this meeting, learning from each other, best practices for climate adaptation and disease control. Also technology transfer, collaborative R&D for innovative health solutions. So there are 3 key areas of ASEAN-ROK and global partnerships. Climate change mitigation adaptation. It's not limited to infectious disease, but general climate change mitigation adaptation. Also infectious disease surveillance and response is always important. That's your business for those who are working in the area of infectious disease. And health system strengthening and universal health coverage. In this process, there are WHO's roles to facilitate regional coordination and capacity building, and provide technical guidance aligned with the global standard, and support ASEAN countries for evidence-based policies and resource mobilization. And there are a few success stories like Lao PDL in the Western Pacific region. So through WHO support, Fiji and Kiribati have received about almost $12 million to build a climate resilient health system, supported by KOICA, Korean International Cooperation Agency. Also, Marshall Island is also receiving support from GCF for readiness of proposal, project development, and also Cook Island also received GCF funding for climate resilient health system building. So WHO is helping member states, particularly vulnerable countries like ASEAN countries, to prepare large-scale health system project to be funded by GCF, GEF, and other global climate financing donors. Okay, this is my presentation, and thank you so much for your attention.
네,
Thank you.
김로코 자문가님의 기조 강연
So thank you very much. That was
큰 박수
Dr. Ro Kim, the
부탁드리겠습니다.
Senior Advisor at the WHO Asia Pacific Center for
고맙습니다.
Environment and Health for his
기후 변화가
keynote
21세기
speech.
경제 모델에 가장
Climate change is one of the greatest threat in the 21st century for public health, and I think he just illustrated the opportunities as well as the challenges. He talked about evidence-based policies and the importance of working together, and also explained to us some best case studies. So with this, we will conclude the opening ceremony as well as the two keynote speeches. We have more presentations and a panel discussion prepared, so we're going to take a short break. So we have refreshments prepared in the back. So we will take a 15-minute break. So please enjoy the break, and we will begin with part 2 after the break.
Ladies and gentlemen, we will now proceed on with the short break to cool things off a bit. Coffee and refreshments are prepared at the back of this conference room, so please do enjoy. And we'll see you back in 15 minutes. Thank you. Ladies and gentlemen, we also have refreshments and snacks prepared at the lobby as well, so please do enjoy. 네, 커피가 로비에도 준비가 되어 있으니까요. 행사장 뒤편과 함께 로비에서도 즐겨주시기 바라겠습니다. 고맙습니다. 네, 잠시 안내 말씀드리겠습니다. 이제 곧 제3회 2024년 한 아세안 감염병 대응 국제 컨퍼런스가 4시 5분부터 오후 세션이 시작될 예정입니다. 참가자 여러분께서는 행사장 안으로 입장하셔서 자리에 착석해 주시기 바라겠습니다. 또한 원활한 행사 진행을 위해서 소지하고 계신 휴대폰이나 모든 전자기기를 매너 모드로 설정해 주시기 바라겠습니다. 또 통역이 필요하신 분들께서는 리시버를 활용해 주시기 바라겠습니다. 한국어는 1번, 영어는 2번 채널입니다. 고맙습니다. Ladies and gentlemen, the afternoon session will begin at 4:05. We ask all participants to please proceed inside and take your seats. Thank you. 네, 잠시 안내 말씀드리겠습니다. 저희 4시 5분부터 오후 세션을 바로 시작할 예정입니다. 참가자 여러분께서는 행사장 안으로 입장하셔서
Ladies and gentlemen, we are going to convene our session at 4:05.
will begin right at 4:05. Please proceed inside and take your seats. Thank you very much for your cooperation. 네, 여러분 즐거운 휴식 시간 되셨나요?
Welcome back, ladies and gentlemen. Did you enjoy your break? Thank you very much. From now on, I'm going to open the floor for our sessions regarding the infectious disease and the emergence conditions, as well as the ways to improve the effectiveness of policies. We have invited distinguished experts here. First and foremost, I'd like to invite An Yoon-jin, Director of CDCA, and she's responsible for the Climate, Health, and Health Hazard Division. And she's going to give us the presentation regarding climate change.
Director An has PhD at Seoul National University with experience as a Deputy Scientific Director at the Center for Biomedical Research at KCDC and also the Director of Division of Rare Disease at KCDC and KDCA. So, ladies and gentlemen, please welcome Yoon An-jin, Director of Division of Climate Change and Health Hazard, KDCA, with a big round of applause.
Good afternoon. As was introduced, my name is Yoon-jin An from KDCA. It is my pleasure and honor to be able to speak before the audience regarding the strategies of the climate and health of the Republic of Korea. I am in charge of the climate change and the health strategy in KDCA. What I'm going to explain today is twofold, as you see on the slide. First of all, I'll be speaking of the global issues and climate emergencies will be explained. Then I'll be talking about the climate health strategy plans of KDCA. According to the WEF, there was a survey to show you the biggest risk of the global health, which is extreme weather. Because of the exposure of the extreme weather and the heat wave, 26.4 billion US dollars and 86.3 billion US dollars are the losses that we see respectively. And they are causing the pandemic and climate change in combination. If you also recall our programs about these countermeasures against the global warming, prior to the industrialization, we had the degrees of the temperature, and we are now reaching the point where it has been heated by 2 to 3 degrees nowadays. This picture must be very familiar to you by now, so I'm going to skip it. Now, after this, we have seen the results on the impact on the health because of the climate change. And many other countries, including the UK and US, are doing a lot of researches like this. And these are the results of the US and the UK. And these slides talk about what activities are being made by these countries. Especially this year, we had a very hot summer. Therefore, we wanted to have the greater warning system for the heat wave and the health. So starting from July this year, they had heat and health initiative against the summer days. Dashboard has been created, and also according to the clinical implications, there is a guideline to show you people about what to do in the case of the very hot summer days. Now, in this slide, I'm going to talk about what kind of counteractions have been implemented by our organization. KDCA, which I am belonging to, is emphasizing the importance of the climate resilient health system. We do have policies like these. First of all, we are doing the surveys and monitoring of the impact on the health because of the climate change. We are also making evaluations and research on the relationship partnership between the health and climate. Also, we are making adaptation policies against climate change, and also we are making literacy and training programs on the climate and health. Global networking and partnership is also our responsibility. In 2017, there was a law enacted in order to have the evaluation on the impact of the health according to the climate change. And then afterwards, in 2021, the first assessment was released in the form of the report. After that, after every 5 years, according to the law, they are to repeat the same assessment. Therefore, the second assessment is to be made in 2026. Now is the time for us to make preparations for the second round of the assessment. What I'm going to emphasize today is that there are many activities in order to systematically respond to the impact of the health and safety because of the climate changes. We have established our program starting from 2018, and what you see here is that we are aiming to have the restoration of the conditions of the human beings because of the climate changes. PPP's public-private partnership is recommended to have these programs for the adaptation. According to the slides here, we have 4 major programs that we are implementing. Number 1, I'm going to now talk about the warning and monitoring system for the public health conditions because of the climate changes. So KDCA is actually monitoring the health institutions across the country, especially around the ERs. So the samplings were made with 500 emergency rooms across the country in order to rapidly identify what kind of emergencies are now prevalent across the country. So we have the aiming of understanding the up-to-date information. Therefore, the real-time assessment of information is made of the day before or the night before. This slide is talking about our zoonotic infections monitoring system, and also it talks about the foodborne diseases system. We have responses to counter the foodborne diseases and zoonotic diseases in this circular system. We have something called Internet, which is about the enteric system that we can identify what kind of pathogens in the enteric form are emerging. 14 species of the bacteria are under control by the hospitals across the country. Now this is another surveillance program that we have. As you see here, dengue, chikungunya, and Zika virus infections, and West Nile, and yellow fever. These 5 are the major adenos-borne diseases, and they are showing you the information and data available from other countries, and also we can see the incoming patients and carriers. Now, as for the 4 insects, which are the vectors and carriers of these diseases, we are monitoring them across the South Korea. They are called vector monitoring systems, so mostly we are focusing on the dengue and scrub typhus concentrations and the outbreaks of the pathogens, as well as their presence, are under control. As you see here, according to the 4 major monitoring systems, we are using the vector net in order to
have the cooperation with other related organizations. Next one, we also have a surveillance system for the respiratory disease. The slide is not moving in my direction. So KRIS or KRISS is a surveillance system for the respiratory virus system, and that is done in a comprehensive manner. So we are controlling the quality of the data as well as the amount of the data. In-depth analysis also included. As mentioned earlier, we have the monitoring system for the respiratory diseases, and then afterwards we also have the respiratory virus prevalence monitoring system. We are focusing on the vulnerable groups as well as the incoming people. So this also includes the data on the elderly population. By looking at the data on the respiratory diseases and its outbreaks, we can prevent further transmission of the diseases. So the idea here is to have the prevention of the disease as early as possible, and this shows the list of the pathogens under control. By KDCA, we are also doing the pathogenic Vibrio bacteria in the marine environment. In order to prevent any transmission of the pathogenic Vibrio bacteria, we have our monitoring system, and we're expanding the monitor companies and also the institutions in order to improve the accuracy of the prediction and projection. We are also working in conjunction with the MFDA. So it's a Food and Drug Ministry. Now you're looking at the system of the monitoring and surveillance of the Vibrio bacteria. We're working with 5 other institutions in order to have the control of this Vibrio bacteria. It is called VibrioNet. The purpose here is to have the betterment of the health conditions of the general public in Korea. We can identify which groups are vulnerable and what kind of knowledge can be shared with them and what actions can be taken on behalf of them. These are the lists of all these brochures and manuals for these populations to follow. We can also develop guidelines and practical steps to follow for these people. They are in various forms, like in the manga form, or sometimes they are in the video form. So they're all for the educational purposes. But nowadays, people are watching videos on the social media, so the YouTube and Instagram are also under use. What I'm going to emphasize in this slide is that we are doing the monitoring for the heat waves on the one hand, but on the other hand, we are also considering to have the monitoring system for other extreme events like forest fires and floods. We're now working with the local governments of Korea in order to collect the data and doing the surveys on the health conditions under the extreme weathers. Now, this is about overseas diseases. We are also looking at what's happening in other countries in terms of the new emergencies. We get the data from them and we identify what level of emergency or risk they are on an up-to-date basis. Third strategy. We have PPP and global network programs for the responses toward the climate changes. Local governments have their health policies, which are very important for the national policies. So we believe that these local institutions can play a big role in getting all the consensus about what to do. Therefore, we are also working with all these different institutions across the different locations. Let me now talk about One Health ideas. So KDCA is also in agreement with the idea that we should have the interdisciplinary and intergovernmental organization regarding One Health. We can have the tabletop exercise for any case of the emergencies or outbreaks when they occur. This is how we are doing the collaboration with other counterparts, as you can just read it, and they are self-explanatory. Climate issues are really international by nature. Therefore, collaboration and information sharing are must in order to cope with these new changes under the extreme weathers and climate crisis. Fourth idea I'm going to share with you today is about the infrastructure building for the measurement of the climate vulnerability. We are doing the field surveys in order to identify the risk factors onto the health because of the weather. An omics study is also underway in each of the region. This is something I have briefly mentioned before. This is the content of the first assessment. This includes the heat, air quality, cold, and zoonotic and foodborne infectious diseases. We now have the result in the report on the 31 evaluation indices in 3 categories, and they have been reported out already. Now this is a roadmap to go forward in the future as the national climate health evaluation is being underway. Not only the central government, but also the local governments can be based on these results of the second assessment when they build up the new initiatives. This has been my explanation regarding what policies we have, briefly so far. Among many organizations in KDCA, we have many departments like this in the list, which are related to the climate change and climate crisis. So all these organizations and divisions are working together. Thank you very much. Thank you very much, Ms. Han. We have been able to understand what kind of risk factors on the health because of the climate change, and also thank you very much for sharing what kind of national policies are there being implemented or being in plan. Thank you very much.
And next, we would like to invite Yum Jun-seok from the Department of Internal Medicine at Yonsei University College of Medicine. The title of his presentation today is Climate Change and Transmission of Infection Diseases. Please allow me to introduce Professor Yum.
Professor Yum's profile. Now, Professor Yum has the medical degree in College of Medicine.
네, 연세대학교에서 의과대학을 졸업을 하셨고요. 그리고 또 성균관대학교에서 의과대학교에서도 또 교수로 활동을 하셨습니다. 그리고 또 전염병
So, ladies and gentlemen, please welcome Jun-seok Yum, Professor of the Department of Internal Medicine at Yonsei University College of Medicine. 여러분 박수로 환영해 주시기 바라겠습니다.
Please welcome Professor Yum with a big round of applause.
네, 안녕하세요. 소개받은 연세대 연구원입니다.
So, as introduced, my name is Yum Jun-seok from the Yonsei University College of Medicine, and as introduced today, we'll talk about climate change and transmission of infectious diseases. So I'm sure that there are part of my presentations that will overlap with the previous speakers, so I will try to keep it concise and highlight some of the points that I wanted to mention today. So I think that there aren't too many speakers joining us today who actually treat and deal with patients, and I actually only take care of infectious patients or patients with infectious diseases. So I would like to talk about, surveillance, the importance of exchanging surveillance information, and how that is very important in the field. And through those activities, I want to talk about how we can effectively prevent the spread of infectious diseases. So, effect of climate change on infectious diseases, many speakers have touched on this, so I won't go into detail. I'm sure that you realize this, but there are many changes taking place, and those changes actually are affecting the pattern of infectious diseases. This is from the WTO, and you can see that there are many reasons why we are seeing the outbreak of infectious diseases. I'm sure that those of you joining us here today are familiar with this data. In Korea, in particular, there are a few infectious diseases that we are dealing with in Korea, particularly, and Professor Kimo already mentioned this. This is from 2011. It's quite a while ago that it was released, but it's looking at climate change impacts on infectious disease risk in Europe. So it was sort of a prediction. And if you look here, you can see that this data was released around 12 years ago, but looking back, you can see that this prediction was quite accurate. So Vibrio, these type of pathogens, you can see, are actually occurring in the more sort of northern hemisphere. Of course, dengue was already being experienced in Europe, and they are an endemic in the southern part. So this is from Korea. It's quite long ago that we released this data. So it's looking at what sort of infectious diseases will actually increase in Korea. Some of these diseases outlined here we are experiencing, and we are seeing increases in the incidences. But these infectious diseases, of course, are increasing because there is the impact of climate change. Professor Kim talked about scrub typhus, and in Korea, I think this is the most common infectious diseases that we witness here in Korea out of the vector-borne diseases. So you can see, depending on the different climate conditions, the numbers differ. And right now, KDCA, they've showed us scrub typhus surveillance data. So the vector breeding sites have actually expanded. And at this point, what we find is that the scrub typhus vector and the vector diseases are affecting not only the southern part of Korea, but they're also affecting Seoul. It covers all parts of Korea. So scrub typhus area of impact has increased. So from Korea's perspective, we will, I think, continue to see global warming happen and related diseases occur in their numbers. Vector-borne diseases, maybe there might be sporadic outbreaks, or they might actually become endemics. So there is a high risk in Korea as well for diseases such as dengue fever. So there is a lot of concern, and the presentation from KDCA illustrated the various surveillance activities. I think this case study regarding dengue fever was an alarming incident in 2014 in Japan. It was very prevalent, the outbreak of dengue fever, and it's not just something that happens in another country. I believe that in Korea, we already have the conditions for a massive dengue fever outbreak. Especially for dengue fever, some of the patients don't have any symptoms, and for Koreans, one of their favorite holiday destinations is Southeast Asia. So not only diagnosis through surveillance health system, but there are patients, who don't have any symptoms, and they might actually spread infectious diseases as well regarding dengue fever. In Japan, a paper was released, and you can see Korea on the map as well. I believe that these infectious diseases can become an endemic. It can start from the southern part, but if you look at the current climate conditions, I believe that the conditions are ripe for a large outbreak, sporadic outbreak. So there are changes taking place in Korea. And then malaria was also mentioned in the previous presentations. Of course, if you look at climate conditions and environment, what this paper is saying, 1 degrees increase will lead to actually 10% increase in malaria outbreak. And malaria is continuing to occur in Korea. But I believe that there is a very strong connection between malaria and climate conditions. In North Korea, they're also affected by malaria, and the main vector, they are saying, is mosquitoes. And this Anisla lesteri, this actually mosquito couldn't be found in Korea before. But from China, there were areas where this particular mosquito bred. But what we can see is that the scope of activity of this mosquito has actually expanded. So in this red box, you can see their main breeding sites. So with the changing climate conditions, their breeding site has expanded, and this has led to more patients with malaria. So here in the southern part of Korea, we see a lot of malaria patients. And if you look at the very effective mosquitoes in terms of transmitting malaria, you can see that they're mostly concentrated in sort of the border area with North Korea. So the malaria's breeding conditions are changing, and so we see patients in certain regions. This, the key vector mosquitoes, they are very active during certain seasons, and that's when we see a large increase in the number of transmission. This, of course, also is closely connected to climate change and climate conditions. So as a clinical practitioner, I think KDCA produces a lot of surveillance data, and the surveillance data actually helps us to treat patients. I think the world today is a very small community, and people travel all over the world. So it is very important to understand the type of diseases that are breaking out in other parts of the world. So through open sources, we are able to get a lot of information about infectious diseases transmission, especially doctors like me who treat patients. So we can't get all of our information from the media news, and so we use a lot of these open source, open data, and this does help us to treat patients. But there are, at the same time, limitations in this type of information. So if we want to have early detection of infectious diseases or learn more about potential infectious diseases that can come into our countries, we need to have good communication channels. And of course, surveillance is important, as well as clinical practice is very important when we think about these communication channels. So this is a global network that I'm part of. It's called GeoSentinel. It's a clinic-based surveillance system looking at travelers and infectious diseases. So as a member of the surveillance system, one of the things that I feel is the strengths of the system. So it's a very sort of open, free network where doctors who are engaging with patients can share information. It's not a government surveillance system. It's more of professionals who are passionate about this topic who can actively and openly engage in interaction and share information. So I believe that this type of network or system actually complements the government-led systems. So for example, MPOX, in our network, about a month before it became a global issue, actually maybe 2 months before it became a global issue, we were talking about this within our network. So we were talking about how it was breaking out in certain groups, and we would share information about what was happening in our area. And that helped us to find out, the cause of the outbreak, and each country was able to share information about what was happening in their country. So even before the media reported on this, the doctors who were treating patients in the field were able to detect signs of this potential outbreak. So I think this helps us to actually effectively detect potential outbreaks and respond to outbreaks. So in order for all of this to happen, the professionals who actually meet the patients, they need to have access to various informations. So we have to know what type of disease is breaking out where. And as I mentioned before, an infectious disease is not pertaining to just one country. It doesn't just stay in one country. It can be transmitted to other regions. And there are infectious diseases, for example, malaria. It is actually found in certain areas in Korea, such as the DMZ, and I'm sure it's the same for ASEAN countries as well. There are infectious diseases that affect the entire ASEAN countries, but then, like infectious disease like malaria might actually break out in just certain areas. So we don't actually share a lot of detailed information. We have just a rough idea. We just think, oh, malaria breaks out in certain areas. So I think the professionals who actually deal with patients, if they have access to more information, if we can have communications or systems where clinicians actually get more information, I think would be very helpful in addressing these infectious diseases. So here you can see on this map, a lot of the activities are focused in the sort of Western world, and there's less activity in Asia. So I hope that in Asia we'll see more surveillance activity, and the surveillance activities will become more reinforced. And I hope that we will have systems in place that allows clinicians to actually communicate and share information. I hope that Korea and the ASEAN member states can come up with this type of system or network where we can preemptively and effectively deal with the outbreak of infectious diseases. So we are sharing this type of information. You can see it's very diverse. We can discuss this within, of course, ASEAN. And with that said, I would like to once again highlight the importance of surveillance system. Thank you very much. Thank you very much, Professor Yang. You delivered a presentation where you examined case studies as well as data looking at the relationship between climate change and infectious diseases. Thank you very much for your insightful presentation.
Moving on, I would like to invite Dr. Nur Hassana Gauch for the presentation regarding mainstreaming the biodiversity and climate action for health security in ASEAN. Let me now explain her biography.
Now, Director Gauchi has PhD of Science Ecosystem at ETH Zurich, Switzerland, with experience as environment consultant at Tropenbos International, Indonesia. So, ladies and gentlemen, please welcome Nur Hassana Gauchi with a big round of applause.
안녕하세요. Good afternoon. My name is Nur Hassana Gauch. Together with our executive director, Dr. Teresa Mundita Lim, we would like to share with you the intersection of biodiversity and climate action and how they contribute to the health security. So our presentation will cover the ongoing triple planetary crisis, how biodiversity plays a critical role in maintaining public health, and the opportunities that lie ahead for addressing these challenges. So what is triple planetary crisis? Refers to the three global challenges, climate change, pollution, and biodiversity loss. And each issue has different causes and consequences, and all must be addressed for building resilience in health security. This is examples of how various environmental issues are interconnected. As you see in the top left in the corner, we have example of tires and salmon. The toxics of chemicals from the tire wear wash into the river and harming aquatic life, including salmon, which are vital both ecologically and economically. So this highlights the interest in the terrestrial and aquatic linkages where human population impact marine life. Oh, sorry. Sorry. To go back. Yeah, it says didn't. Go back. Yeah, go back. Yeah, sorry. So moving on the top right, B, panel B, it shows that neonicotinoid insecticides are showing impacted non-target species, while these chemicals are used to protect crops from pests, but they unintentionally harm beneficial insects like bees and butterflies, which play critical roles in pollination. And this shows how action intended to boost agricultural productivity can inadvertently harm biodiversity and ecosystems that we depend on. And when you see in the bottom left panel C, we see the effect of mercury from mining, where harmful substances are distributed through ecosystem, threaten tropical environments, and mercury contamination affect aquatic and terrestrial life, disrupting food chain and threatening human health as well. And finally, the bottom right, panel D, shows the UV filters coral bleaching, representing how pollution combined with climate change causes coral bleaching. As water temperatures rise due to global warming, chemicals like those in sunscreen can also exacerbate coral bleaching, like threatening coral reefs, which are essential for marine biodiversity and also impact to millions of livelihood. So these are examples how this environmental issue can deeply interconnected. And we move to the biodiversity. So biodiversity decline caused by global climate change. And this has strong link with the emergency infectious disease. Declining habitat of species means there is a declining of lost species in certain habitat through, for example, fragmented habitat, mostly due forest conversion and wildlife habitat into agriculture, resulting in a human-made island ecosystem. So my point is that when biodiversity decline, it's reduced ability of the habitat to prevent disease dispersion. And research also show that biodiversity linked, or biodiversity to forest cover linked to the increasing of the outbreaks borne and zoonotic disease. So for example, when you see graphic A and C is quite contrary. So for example, C, the forest covers going down, but you see the zoonotic disease going up. And also, if you compare with B, the factor borne outbreaks also going up. And then when you see D, palm oil plantation, which is cost deforestation also increase. So these are, that's meaning that, there is decreasing effect of zoonotic disease, while there is a global deforestation of increasing deforestation and affect the biodiversity. And this is another research that the increasing species facing extinction from disease. Maybe I would like to skip this as we have already a lot of explanation before. And as a global climate change happened, so there are frequent extreme weather events like floods and droughts are increasing health risk and damaging biodiversity. Droughts harm water and causing habitat loss and species migration, while floods severely impact cropland in Thailand, for example, Cambodia and Myanmar, and biodiversity loss driven by deforestation and even worsened by these weather events remain a major challenge in ASEAN. So to combat these growing threats, ASEAN countries need to focus on health adaptation. So this involves developing policies and strategies that are resilient to climate change while also protecting ecosystem. And preparedness, public health measures, and ecosystem conservation can potentially mitigate many of diverse health effects, and actually we already starting to see it. Sorry, this is, I would like to show you our publication also related to the health adaptation. So these are key areas where biodiversity can play a vital role in addressing and preventing pandemic. So for example, we need to conserve wildlife and their habitats, adopt the One Health approach, ecosystem restoration, promote urban and agricultural landscape to build resilience, and enhance regional and sub-regional synergy. And this is where the concept of natural-based solutions comes into play. By protecting, conserving, and restoring a natural ecosystem, we cannot only enhance biodiversity, but also bolster our resilience to the health threats. As defined by the UNEP, the United Nations Environment Assembly, natural-based solutions help address social, economic, and environmental challenges effectively. And this framework, along with the recent pronouncement from ASEAN leaders, set the path toward a vision of resilient ASEAN, one that responds to current crisis and ensure that it will not happen again. And we also successfully implementation of this strategy through regional and global cooperation. And this is the crucial for success. And this is our key action within our framework to recover and building resilience. First, for example, we need to raise public awareness. This is crucial, and we need to improve communication. And then second, we need to collaborate, multi-sectoral collaboration in biodiversity and health, including private sector partnership. And third, we need more biodiversity and health research and capacity building. And the last, we need biodiversity and health harmonized plan, policy, and programs. I think this is my last, okay. Finally, we have tools like ASEAN Biodiversity Dashboard. This tool will help us to measure in protecting both biodiversity and public health. You could also visit the website, just click ASEAN Biodiversity Dashboard, then we always updated the, for example, this one is distribution of the zoonotic disease event case study in the in ASEAN, but we continue to update it. So I think that's all for me. It's not it's not that long. Thank you very much.
네, 박사님의 주제 강연 고맙습니다.
Thank you very much,
부탁드리겠습니다.
Dr. Gouch. Once again, please join me in giving her a big hand. She has been giving us the biodiversity in conjunction with the health strategies and policies. And thank you very much for sharing for us a lot of case studies.
아세안 사무국 보건부 MBT 프로그램 코디네이터님께서
So we are going to invite Mr. Michael Glenn, the MBT Program Coordinator from the ASEAN Secretariat. He's going to talk about ASEAN's regionalized initiative for strengthening health security and preparedness against public health emergency and biological threats.
Profile. Mr. Glenn has a master's degree in international relations and affairs at the University of Pelita Harapan and experience with a technical officer for health division at the ASEAN Secretariat. He will be also joining us online. 현재 온라인으로 함께 참석해 주고 계시는데요. 화면을 통해서
He's joining us online. Why don't we meet him virtually?
Can you hear me?
We can hear you. I can hear you loud and clear. Can you hear me?
Fantastic. We can hear you loud and clear. So please proceed on with your presentation.
Thank you so much. Excellencies, colleagues, and friends. Again, my name is Michael Glenn. I'm the Program Coordinator for Health Security in ASEAN Secretariat. It is my great honor to be here at the 2024 ASEAN Republic of Korea International Conference on Response to Infectious Disease. As we gather here to address one of the most pressing challenges of our time, the interface, the intersections of climate change and infectious disease. First and foremost, I want to extend my gratitude to the Republic of Korea and our partners for bringing us together for these important discussions. For these presentations, I will be focusing to share and to level our understanding on how the ASEAN health sector mechanisms, operations, and how the health security programming supports ASEAN and ASEAN member states in preparing and managing public health emergencies. This is to taking on all of the keynote address and colleagues that has been presented earlier, the importance of regional multi-sectoral cooperations to address these public health impacts due to the climate change. So to start, these are four main topics in my presentations. There are some components that I will be quite fast forward because there are I think more than 23 slides. So allow me to start with the first component on the ASEAN post-2015 Health Development Agenda. So this is to give you an overview on and to also level the understanding and to share on how ASEAN developing our own blueprints, our own agenda, particularly for the ASEAN health sector. Please be informed, in the left side, you will see when we develop the ASEAN post-2015 Health Development Agenda, which is our guides in the next 10 years until 2025, coming soon, we really considered not only regional, but also national, sub-regional, regional, and global priorities. So in the left side, you will see a lot of documents and agreements made at the global level and also at the national level. We take into considerations when we develop our agenda of the ASEAN health sectors. And it resulted with in the right side, that's the 21 health priorities through 4 health clusters for the operations level. So I will not go through directly because you will be having this presentation. So this is just to show you. These are the APHDA, that's ASEAN Post-2015 Health Development Agenda goals. And for these specific topics, I will be focusing on the ASEAN Health Cluster 2, responding to all hazards and emerging threats. And in this slide, we would like also to share with all of you, this is the mechanisms and the government's implementations of the ASEAN health sectors. When we doing the operational work at the regional level. So you can see the layers at the top, of course, that the ASEAN health ministers, the SOM, and then the clusters at the operation level. So we also would like to inform you that the ASEAN Republic of Korea, we also have a regular engagement through the regular senior officials meeting in annual basis, and also the ministerial level through the ASEAN Republic of Korea Health Ministers meeting that was once every 2 years. We just recently conducted a few months ago in Vientiane, Laos PDR. And then allow me to go directly to the second topics, which on the ASEAN health priorities, responding to all hazards and emerging threats. Again, I will not go through one by one, but you will be having this reading for your reading materials that in our operational mechanism for at the regional level, these are the regional strategy. These are the regional strategies in addressing all of the common gaps and challenges of ASEAN member states. You can see there that we highlighted in red, there are specific strategy to strengthen the capacity to manage environmental health risks and issues, health impact assessments, and impacts of climate change towards health. And just to be specific, recently, starting in 2021, we had a specific initiatives at the regional level on enhancing or providing a capacity building platform through a training course on climate change and health for ASEAN member states. This is aiming to enhance the knowledge of the health practitioners on climate change and health and skills in the management of the health risks associated with climate change. And this slide, this is one of my favorite slides, that this is, we're trying to visualize the ASEAN health sector architecture in responding to public health emergencies and disaster health management, which also include impacts from the climate change. So you will see different initiatives with the different areas of expertise. They are playing the interplay between one to another. Um, uh, Allow me to go directly to the third topics. This is one of the concrete actions, an example on how the regional mechanism addressing a specific concerns by ASEAN member states. In this case, is a health security initiatives in ASEAN. So um, this slide is really showing all of us here the importance of uh, characteristic or the importance of qualifications for a initiatives or a concerns to be a regional ASEAN initiatives. There are three characteristics that need to be satisfied. One, these initiatives or these areas of cooperation shall address the common gaps and challenges of ASEAN member states. Second, these initiatives it should be led by ASEAN member states and should be participated by all of the ASEAN member states. And the third one, it shall follow the ASEAN-led mechanism, which the approval and the implementation mechanism. So by having these three characteristics satisfied, then it can be leading to a programmatic approach that will be adopted as the ASEAN health sector operations or work plan, to be in sense. Um, just to show you, it's a long investment. For example, when we are discussing about enhancing the health security capacity of ASEAN member states, we started the investment way back in 2014. So it's already 10 years where we really start the commencements of the mitigations of biological threats program that has a long journey involving all of the ASEAN member states started in 2014. So what is the MBT program? So the Mitigation of Biological Threat Program is a program which was designed, again, it way back in 2014 to mitigate a wide range of biological threats, to enhance the capacity of AMS to prevent, detect, and respond to a diverse biological threats, whether natural, occurring, accidental, or deliberate, to support international and regional initiatives, and to address the critical vulnerabilities and strengthen essential regional capacities. As I mentioned before, the MBT program with each of the components, for example, the ASEAN Emergency Operations Center Network, the ASEAN Biodiversity Virtual Center, which the Republic of Korea is also playing an important part in the operations of the ABVC, the investment that we made way back in 2014 is really made the proof. So it somehow is a proof of concept of the regional cooperations during the COVID-19. So one of the example is on how the ASEAN EOC network and how the ABVC is really working together and has been an instrumental component of the ASEAN response to the COVID-19. So again, this is just a quick visualization, so I will not go through it in detail, but how the MBT program is supporting ASEAN in the operation level, in the policy advocacy, coordination, and also mobilizations of resources. This concept, this model can be applied as well to the specific climate change and health intersections that we need to have a specific investment that we can starting from now, even actually we already started. And again, as mentioned by so many presenters earlier, that the multi-sectoral coordination and cooperations is highly important. And coming to that point, the MBT program is also a platform for partners to really working together with ASEAN member state. And as a result, in 2022, KDCA through Korea through KDCA provided a commitment to support the ABVC operations for the next 5 years. 2023, the UK Health Security Agency is on board with us to support the operations of the ASEAN Emergency Operations Center Network. COICA, Korea through KOICA, again, provided support for the development of the learning management system of the ASEAN Emergency Operations Center Network. And USCDC is also on board. So having this kind of platform whereby all of the stakeholders, all of the players in health security, and in this case, we can also build on climate health intersections is critically important. So then all of the efforts, all of these resources can be synergized and not duplicating efforts one to another. I will just go through very quickly on the ASEAN Biodiaspora Virtual Center. This is envisions to be a regional data hub for pandemic and epidemic intelligence, for national, regional, and data hub for strengthened pandemic preparedness and response in the region. So the ABVC is currently based in Indonesia, in Jakarta. They produce this report in regular basis. For example, the media monitoring is 3 times a week. This is alert. This is an early warning mechanism, one of the early warning mechanism that issued by the ABVC by disease event. Morbidity and mortality weekly report. This is issued in a weekly basis. Specific risk assessment report. This is based on the request by some member states or by ASEAN. And then focus report. This is an in-depth analysis of certain diseases in ASEAN or by requested of one of another ASEAN member states. Okay, that's one of the model. And then last that we wanted to share with all of you is how we as the regional organizations contribute to strengthen global and regional health security. One of it is through the recently established ASEAN Center for Public Health Emergencies and Emerging Diseases. This is the young brother, the younger sisters of the ASEAN Center for Biodiversity. And this was announced, the establishment was announced in 2020 during the pandemic. This is one of the prominent or the only regional entity was built or announced of its establishment during the COVID-19 that aim to strengthen ASEAN regional capacities to prepare, detect, and respond to public health emergencies and emerging diseases, and also as a center of excellence and regional resource hub. As agreed by the health ministers in 2022, each pillars will be spearheaded by specific member states: prevention and preparedness by Vietnam, detection and risk assessment by Indonesia, response, including risk communications by Thailand. And three of each pillar will has its own overarching capacities in information sharing and analytics, capacity building, innovations, coordination, and support, which also include the R&D. So we are looking in the very near future, this ACFEED, we call it ACFEED, the ASEAN Center for Public Health Emergencies and Emerging Diseases, will be in operations in Vietnam, Indonesia, and Thailand. And the Secretariat of ACFEED will also be located in Thailand. So this is one of the regional actions and contributions to the global efforts in strengthening health security. Last but not least, we also wanted to highlight one of the important role and one of the best practice that we got recently under the leaderships of Lao PDR. Our friends from WHO mentioned that Lao PDR has a good best practices in applying the WHO guidelines. At this point, taking the opportunity being the ASEAN chair in 2024, Lao PDR is pursuing and leading the region through the ASEAN health sector in coming up with the highest leaders declarations, the highest commitments through the ASEAN leaders declarations. This will be the cornerstone and anchor in the development and implementation of specific initiatives or concerns. At this point, at this time, Lao is spearheading the ASEAN Leaders Declaration on strengthening regional biosafety and biosecurity. So the development of this leaders declaration is not coming from nothing. It's really coming from a specific concerns shared by ASEAN member states and also by a global agenda due to the emerging and re-emerging infectious disease, the increased number of natural, accidental, and deliberate biological threats, the preparedness for public health emergencies coming from the lessons from the COVID-19 pandemic, international commitment, regional and coordination, regional cooperations and coordinations. Therefore, Lao PDR spearheaded the development this highest political declarations on biosafety and biosecurity. So then, looking at the impacts of climate change on infectious disease or the impacts of climate change on the public health, and also looking at the spectrums, the importance of the cross-sectoral multi-agencies cooperation in addressing these potential threats is a solid rationale in looking at the highest political commitment for this issue that will ensure the participations or the engagement of all relevant agencies, and more importantly, for mobilizations of resources. So, Excellencies, colleagues, and friends, this is the end of my presentations to giving you the overview on how the ASEAN mechanism, particularly the ASEAN health sector works, and how this model can also be applied in strengthening the ASEAN capacity, the regional capacity or the global capacity in reducing, managing the impact of climate change at this point in time and at the future manner. With that, I end my presentations. Thank you so much.
Thank you, Mr. Glenn, for sharing your valuable perspectives with us. So please stay with us till the end for the panel discussion as for the next presentation. 네, 그럼 마지막 주제 강연 발표가 있겠습니다.
And next, I'd like to give you the next speaker. Welcome Dr. Swawadi Puksambat, who will be talking about the effect of the climate change on vector-borne diseases risk in Thailand. I'm going to now give her biography.
Now, Deputy Director has the PhD of Tropical Medicine at Mahidol University of Bangkok, Thailand, with an experience as medical scientist at Malaria Division at the Ministry of Public Health. So, ladies and gentlemen, please welcome Swawadi Puksambat, Deputy Director of the Ministry of Public Health of Thailand. Please welcome with a big hand.
Good afternoon, ladies and gentlemen. 안녕하세요. 사와디카. Yes, first of all, I would like to express my sincere thanks to organizers to invite me to be here on behalf of the Director of Vector-Borne Diseases. Today, I'm not going to present anything. I just would like to share my experiences on prevention and control of vector-borne diseases. This is our title, Effect of the Climate Change on Vector-Borne Diseases Risks in Thailand. Here, the contents of the presentation here, we were talking about the potential impacts on health determinants from climate change and how climate change affect to the vector-borne diseases. What kind of major vectors and vector-borne diseases in Thailand? What are the lessons learned from dengue outbreak in 2019 and 2023? And what are the control measures and epidemic preparedness and response for ED-borne diseases? And what about the risk factors and challenges on the vector-borne disease prevention and control in Thailand? Now, we're talking about the potential impacts on the health determinants from climate change. We all know about this picture, so I'm just talking about the WHO forecast, the scenario in the 26 or 30 years ahead. They will be having the dates due to the global warming around 250,000 people per year, and we will have loss of life and injuries from flood, storm, cyclone, and fires. Morbidity and mortality from heat waves and air pollution will increase, and heat stress or PM 2.5 will be increased also. Health consequences of outer fresh water and supplies and the contaminated water will be increasing, and also the cholera. Change in range and seasonality in infectious diseases such as influenza, vector-borne diseases, dengue, and malaria. You also hear about this. Change in agriculture food productivity and also increased population displacement, especially the vulnerable people, minority groups, or Hill tribe people. This is a true story in Thailand, where the flooding in Chiang Mai, in the northern part of Thailand, not only in Chiang Mai, but also in Chiang Rai. This is unusual rains and flood destroy roads and houses, and over 20 killed, hundreds injured, and the displacement in the northern province of Thailand. Children, workers, and volunteers are helping local tourists in flood area and move to the safer locations. How climate change affect to the vector-borne diseases? Climate change causes the seasonal variation and unusual rainy season, which facilitate breeding and proliferation of the mosquito. As you can see here, there's the relationship between the host agents and mosquito. Once something increasing, there will affect to all of the factors. If you cut the pathway between host and mosquito, the transmission will not happen. But if you increase something, like mosquito increasing, the agents that can carry the virus will increasing also. So the second, the increasing number of rainfall, temperature, and humidity facilitate the transmission of mosquito and breeding places. The average global temperature was rising in every year, will be affected to be shortened the mosquito life cycle. For instance, the temperature is optimal temperature is 30 degrees Celsius. They're using 12 days to complete all the life cycle. But why if heat up to 23 to 25 degrees Celsius, they're using only 7 days to complete the life cycle. It means there's a lot of mosquito fly away in your house. Droughts may affect to more frequent biting time and bad feeding of mosquito because of the dehydration. As human, when we're thirsty, we have to drink more, right? But for the mosquito, they will drink, but that's not a Dacron, but they drink but for something. Okay. Here is a life cycle of eating mosquito as example. There, this we call as complete metamorphosis. Start from eggs, to larvae, pupa, and adult. And female adult need to have blood feeding to lay the eggs. So it is a complete life cycle again and again. So that's why the mosquito cannot be killed from our community. What kind of measures, vectors and vector-borne diseases in Thailand? In Thailand, we have 7 diseases: dengue, Zika, and chikungunya, malaria, lymphatic filariasis, leishmaniasis, and scrub typhus. Mostly are the mosquito, and they carry so many types of the pathogens: virus, protozoa, nematode, and rickettsia. This is a kind of the bacteria. So we all know this. This is the graph showing the relationship between monthly dengue and malaria cases and the number of rainfall. The blue line stands for the number of rainfall, and the red line stands for the dengue cases and the malaria down below. So you can see they're corresponding together. Once the number of rainfall high, the dengue case and malaria also high. Except 2 years, 2021 and 2022, because of the COVID-19 pandemic. We closed the country. We have work from home. We have social distancing measures, and we have a lockdown situation. So no one go out of the house, no transportation, nothing. But it's good for the dengue and vector-borne disease because there's no transportation. It's good not only the dengue, but also for influenza, hand, foot, mouth. But a few cases found during these 2 years, during the pandemics of the COVID-19. Why? Because there's a lot of plastic food containers from the convenience store. Because we cannot buy something, right? We buy from the convenience store. There's a lot of plastic food. Even we throw in the plastic in the garbage bin. But once it's windy time, the plastic blows somewhere and drop by under the tree, and that day is rain. That will be a new breeding places. That's why it still have a case found during the pandemics of the COVID-19. Okay, let's learn from the dengue outbreak. The expansion of urban community affect to high population density and enhanced man-made breeding places and containers. Good transportation may lead to have high traveling and population movement from endemic area throughout the country. And also the seasonal variation and climate change. Changing pattern of the circulation dengue serotypes in endemic area. Dengue have 4 serotypes, dengue 1, 2, 3, and 4. And adult dengue cases are late admission and delayed treatment. Most of them are self-treatment. And dengue-related deaths were mostly adults associated with a non-communicable disease, underlying diseases, and having NSAID drug use history. And NCD underlying disease is just like a heart disease, hypertension, diabetes mellitus, something can cause death from the dengue also. This is the distribution of the case of the dengue cases in Thailand. As you can see here, the 2019, they have the cases more than 130,000 cases. When compared to the 221 and 222, and this 223, you're looking at that one, the case up to the 158,000 cases. This is epidemic occur in this 2 years. What about the control measures and epidemic preparedness and response for ED-borne diseases? We have four control measures. It consists of surveillance, prevention and control, case management, and risk communication. And we also have additional control measures to apply insecticide repellent in dengue patients to protect mosquito bite and to reduce the spread of viremia to the community. And this is the preparedness and response for dengue borne diseases. We divided into 3 phases. This is pre-epidemic, before epidemic. This is during epidemic and after epidemic occur. If we do something good, like we do a survey in pre-epidemics, we call the golden period for elimination of the larvae and adult mosquito within 2 to 3 months. The epidemic will not be happen in the seasonal peak of epidemic like that. So we have to do something to prevent epidemics. This is the vector control measure use. We also have the biological, physical, and chemical control measures. For the vector, for the biological, we use the larvivorous fish, the fish that can eat the mosquito larvae. For the physical, we do the cell protection to protect ourselves from the mosquito bite. You can sleep under mosquito net, wild mist, or apply repellents, better using the chemical-free. For the source reduction, the breeding place and elimination, and also waste product and environmental management is also need to be done. And for chemical, we will have to use is very low amount when compared to the nuclear plant and the chemical factory. It is very small amount to using, but it's good when we have an epidemic outbreak to reduce the man and vector contacts. So we use the space spray, insecticide residual spraying, and also larvicide is called temifos, and then with sand granule something. So this is an intensive vector control. And risks, what kind of risks and challenges on vector-borne diseases? When climate heats up and rainfall patterns change, it should be transmission, it should be start from June to August, but they come earlier from May to maybe July. So it is the rainfall pattern change may affect to the adaptation of the vectors from season changes contributed to the spread of the vector-borne diseases. Most of infected people have asymptomatic or mild symptoms cause late hospital admission and delayed treatment. So if you carry the parasite in your blood, when you was bitten by the mosquito will be the infected mosquito and can bite to another person. So this will be transmission occur. And also the insufficient health staff has been trained for diagnosis and treatment on vector-borne disease. They are new medical doctor, new coming staff, they have never been trained for treatment. This will have some problem. Few cases report from the clinic or private hospital to national surveillance system. So patient can go to any kind of the health care facilities. We have to increase the accessibility to the health care services. So when they go to the hospital, they can record. But when they go to the private clinic or private hospital, record will be missing something. About the dengue cases with NCD underlying is also talking about. Inadequate risk communication and potential key messages for prevention and control diseases. Vector control is ineffective. During the COVID-19, all campaigns and mosquito survey cannot be implemented during the lockdown situation and social distancing measure. So this is the proposed our plan. We're using the smart surveillance and emergency management. We engage the community and network as community ownership. We enhance knowledge of the health literacy, strengthen the diagnosis and case management, develop the research and innovation tools for combating the vector-borne diseases, enhance the effective communication, collaboration, public-private partnerships, and work together as one community, like Dengue Zero. Encourage the sustainability of the disease prevention and control activities among the partnerships on Asian Dengue Day, Big Cleaning Day, and World Malaria Day. Strengthen the community engagement and social mobilization to increase people's awareness and alertness in reduction of the man-made breeding places and man-mosquito contact through the district health board mechanism. This is all the relationship between the EDs, and I have no time to explain. I just a little bit. We will never walk alone. We have to need a partner to invest something because the government office have limited resources in terms of man, money, material, and management. We need some partner to do something like we do MOU, Memorandum of Understanding with the Thai Meteorological Department to share the data from the rainfall, precipitation, and the temperature, and we share dengue case and malaria case to them. So we share together, but we have the same idea. Okay, this is MOU, and this is community participation to looking for the levy survey in school, temporary and workplace, and this is also dengue work, something. Innovation, as I told you. This is online application, and this is clinical practice guideline for ED-borne diseases. And also this is a picture showing the ASEAN-ROK Day that we went through some exhibition hall. Okay, thank you very much for your attention.
네, 부국장님의
감사합니다.
네, 고맙습니다. Thank you very
So
much for your thought-provoking insights. 태국의 기온 상승과 또
So she talked about the increase in temperature in Thailand and how it has impacted vector-borne diseases, and also she talked about measures to prevent vector-borne diseases and shared with us some case studies. So once again, thank you very much for your presentation, Deputy Director. And so we just heard the presentations from the 5 speakers. I hope that you found the presentations very productive and engaging, and we are now just going to proceed to the panel discussion. For panel discussion, we need to set up the stage, so please wait wait in your seats for a few minutes. So we just heard 5 presentations, and we heard case studies regarding how to prevent infectious diseases regarding climate change. And so through the panel discussions, we will continue our dialogue and have in-depth discussions on this topic. So I'm going to now summarize the presentations.
First presenter was Ms. An Yoon-sin. She talked about the strategies on the public health policy by the government. She has been giving us the detailed plans by the government onto the effect of the population. Detailed plans and examples were shared. Second presenter was Professor Yum Chun-sub, and he has been giving us this infection and transmission of the infectious diseases in conjunction with the climate change. We were able to understand what is the interlinked relations based on the international studies and statistics. Detailed ideas were also shared. And third speaker was Dr. Nuruhat Chazaga, and she has given us the expansion of the security of the health in ASEAN countries, the impact as well as the health hazards with the threats onto the population of the ASEAN because of the climate change was explained. Many policy initiatives were also explained. Fourth presenter was Michael Klein from the MBT programs, and impact and management of the data on the public health was explained. Various topics of the climate issues require multi-country cooperation according to his suggestion. Last but not least, Dr. Sundi talked about the impact of the climate change onto the Thailand cases. The mosquito vector infections were explained in detail. We were able to witness what kind of case studies are there in Thailand, along with their policies by the government. Thank you very much for these presenters. Based on their ideas, we will continue our discussions with our panelists. So the panelists will come forward with our ideas about the strategies for responding to infectious diseases and global cooperation between ASEAN and ROK, the Republic of Korea, in the era of climate crisis. I believe that these discussions will be beneficial and imperative for making policies of the cooperation between our countries. For the audience, we will open the floor for the Q&A at the end of the day. Therefore, please stay until that moment. Without further ado, I'd like to invite all the panelists up to the stage. Please join me in giving them a big hand.
For the panel discussion.
Thank you very much. We will now invite moderator Professor Oh Kyung-hwan of Dankook University College of Medicine. When I call the names of the panelists, please give them a big hand. Now we will invite An Yoon-sin, Director of Management, Korea Disease Control and Prevention Agency, and Professor Yum Chun-sik from University, and we will have Mr. Nuruhat Gauchi, Director of Division of Biodiversity of ASEAN Center for Biodiversity, Michael Glenn, the Global Coordinator of ASEAN Secretariat Office, and lastly, we will have Swapwadi Poksumbad, Deputy Director of Ministry of Public Health in Thailand. I'd like to now ask Professor Kwan as moderator. I'm going to now give his profile
For our chair. Now, Professor Kwon has the PhD in Preventive Medicine at Seoul National University with the experience as the board member of the Korean Society for Preventive Medicine. 여러분, 좌장님을 큰 박수로 환영해 주시기 바라겠습니다.
Please give him a big hand.
네, 교수님 그럼 진행 부탁드리겠습니다.
Now, Professor Kwan, the floor is yours.
따뜻한 소개
to serve as the moderator of this important symposium. And I'd like to welcome the audience who have stayed for a long time and participating in panel discussion. It's a long day, isn't it? So as the topic of a panel discussion is responding to infectious disease and global cooperation between ASEAN and Korea, we will divide the session into two parts. In the first round, we will hear from each panelist about infectious disease response in their settings. And in the second round, we will discuss the ways of cooperation. So as the first round, I'd like to ask each panelist to talk about their experience. So I want them to summarize their presentation, focusing on infectious disease response within 5 minutes. So let's start with Director An. 안현진 과장님, 네, 첫 번째 토론 부탁드리겠습니다. 네.
Director On, the first speaker is you. Thank you. As for the response to the infectious disease under the influence of climate change, as I explained in my presentation, we can factor into the medium and long-term policy of our government. The first and foremost thing is to have the surveillance and monitoring as well as evaluation of the current status. That's the starting point. In order to have the long-term plan, we have to know where we are, and then we have to predict the process and the route. Based on all these surveys and examples, we can get the framework, and we also that will be very helpful for setting the direction of the future. As the climate change gets aggravated, originally we were also doing the responses for the infectious diseases, but the situations have been aggravated over time. Therefore, surveillance systems should be added on top of that. Earlier, I talked about our monitoring and surveillance systems. When I explained, you might have noticed that human disease surveillance and the surveillance of the agents and carriers are all included in them. So we can identify the characteristics of the pathogens, whether they are the gene characteristics. We can identify what kind of expectations can be made. So that's part of our diagnostics surveillance. Also, in order to respond to the outbreaks, we can control and manage these viruses. And also, we can look into the maritime environment in order to preventively looking at the impact of the human health conditions. Therefore, these routes of the surveillance should be very diverse, and they should be interlinked very closely. So for us, within these long-term and medium-term plans, we should make the existing surveillance systems and monitoring systems more closely and minutely. That will be something that we will add in the future. So in the international collaboration, this thorough preparation will be very important. That's my case.
So thank you very much. We'd like to invite Professor Yum Jun-seo from the Yonsei University College of Medicine. So during my presentation, I already mentioned this, but I think information exchange and communication is very important. With regard, of course, we're talking about climate change-related infectious diseases, malaria, dengue fever. These are infectious diseases that we already know about. We have data and we've had discussions on these infectious diseases, but I think there are newly emerging infectious diseases that we should also consider. But as a clinician who deals with patients, I think the accuracy and the timeliness of information is very important to us, especially for the newly emerging infectious diseases. I believe that timeliness of that information is very important, and to that end, we need to have various communication channels in place. Officially, we do get, information and data. They're actually filtered, but while we are treating patients, even if that information has not been validated, we need information to quickly respond to our patients in the field. So with our surveillance system, I think the information from the existing channels need to be integrated so that for us clinicians, we can better deal with our patients in the field. Thank you very much, Professor Yam.
Dr. Nuru Hasina Kahu, please.
Thank you very much. Yeah, as I mentioned in my presentation, that we face a triple planetary crisis, which include climate change, biodiversity loss, and pollution. And those challenges should be addressed together. Also, the decline in biodiversity has been closely linked to the emergency and spread infectious diseases, particularly for zoonotic and vector-borne disease. And for example, the changes in forest cover, rising temperatures, and environmental degradation have all contributed to the increased risk, as Richard said. And also, this include, for example, disease like malaria and dengue. So for example, the papers Morant and Lajauni 2021 emphasized that the need for biodiversity preservation to curb this health risk should be backed by research. You say that biodiversity plays a pivotal role in ensuring human well-being by providing ecosystem services, promoting resilience, and addressing both environmental and social challenges. So that's why we need for health adaptation strategy that integrates biodiversity and climate action. For example, a proper inclusive and climate responsive approach is recommended to strengthen policy framework and government at all levels, in particular in cooperation among ASEAN nations. So it's very essential to fill the government gaps and promote the integration solution that span sectors such as, for example, agriculture, transport, and education. I think that's all. Thank you.
Thank you. Thank you very much. Our next panelist is Mr. Michael Glenn. Mr. Michael Glenn, are you ready to speak? Yes, please.
Thank you, Professor Kwan. Thank you so much. So allow me to emphasize again the angle of presentations, the angle of informations that I'm sharing to this through this panel discussions is on how the regional cooperations is supporting the ASEAN member states in responding to public health emergencies. So we agreed that the interconnected of the global community grows, and it so does the risk of biological threats, infectious disease, climate change, and also other public health emergencies. ASEAN, since 10 years ago, even more, has prioritized the health security and preparedness across its member states. One of it that has been my presentation, that which was presented earlier, is the mitigations of biological threats. The MBT program, in short. The MBT program is really the core objective is to prevent, detect, and respond to biological threats by enhancing public health system at the region, fostering, establishing, and nurturing regional cooperations, and establishing a robust mechanism for early warning and rapid response in ASEAN that will also supporting the national response. This program is also integrates efforts to address emerging and re-emerging infectious disease, acknowledging and also noting the crucial link between health security, climate change, and evolving global threats. Since its inception, the MBT program has really made a substantial progress in strengthening regional health security architecture. One of it, the ASEAN Emergency Operations Center Network, which was established in 2017, has played an important role and served as crucial hubs for coordinated actions during public health emergencies. The EOC networks, which the members of its networks are the HR focal points from all ASEAN member states, provide a real-time information sharing, data analysis, and rapid decision-making capabilities that supports, attributes, and complement the member states in responding efficiently to the outbreak and other threats. On the other side, the ASEAN Biodiaspora Virtual Center, which one of the component of the MBT program, is also a regional entity that has a capacity to provide near real-time surveillance and risk assessment of infectious disease. While I'm talking right now, at this moment, the ABVC is sharing the ASEAN Biodiaspora Virtual Center, in short, ABVC, is sharing its disease alerts on the Mpox Cloud 1B in Germany, which was detected on 22nd of October, announced on 22nd of October, and other disease alert that currently being circulated to all of the ASEAN member states. So having this interplay between the ASEAN EOC network and the ABVC, it's really expanded and complement the region's work in addressing the and managing the public health emergencies. At this point in time, MBT is really expanded its focus to complement the region works in addressing the increase of climate change on health security. One of it is a focus on building the resilience through capacity building activity, as well as the networking system through the ASEAN EOC network. Therefore, just to conclude, the mitigation of biological threats program can stand as a testament to the ASEAN dedications as its regional work, as its regional cooperations in the face of evolving biological threats by building a robust and resilient health security framework, mechanisms, as well as political commitment and resource mobilizations to ensure ASEAN member states are well prepared to address the current and the future public health challenges. Professor Kwan, with that, thank you so much.
Thank you, Mr. Michael Glenn, for your nice talk. And our last panelist in the first round is Dr. Supawati Pongsumbat. Please.
Thank you, Mrs. Chairman. So I would like to make a short summarization of my presentation. So we all know vector-borne diseases is human illness caused by parasite, bacteria, and viruses that can be transmitted by vectors. So in Thailand, they have 7 major vectors and vector-borne diseases in Thailand, namely dengue, malaria, Zika, and so on. So, but the major problem, public health problem in Thailand is dengue and malaria. So lessons learned from the previous dengue outbreaks were from several factors, namely seasonal variation due to the climate change, changing the pattern of the circulation of dengue serotype in endemic area, unplanned urbanization, and population movement which leads to have the man-made breeding places more in the urban area. The risk factor and challenges on the vector-borne disease prevention and control in Thailand were related to the climate heats up and rainfall patterns change may affect to the adaptation of the vector contributed to the spread of the vector-borne diseases in Thailand. So, however, the strengthening of the community engagement and social mobilization to increase the people's awareness and alertness in reduction of the man-made breeding places and man-mosquito contacts urgently need to be done. The engagement of the community and the network as community ownership and shared responsibility for disease prevention and control are very crucial, which can reduce the transmission and preparedness for the next coming outbreak occurrence. Thank you. 감사합니다.
Thank you. Thank you very much. As we heard from all our panelists about their response to infectious disease, we will move on to the second round. In the second round, I would like to ask each panelist to suggest ways in which ASEAN and Korea to cooperate to respond to infectious disease in the era of climate crisis. 우리 또 안 과장님이 또 먼저 말씀 부탁드리겠습니다. 네.
Once again, I have to start with Dr. An first, as before. Thank you. In order to cope with the infectious disease in the areas, global cooperation has been emphasized over and over again, and we are here to talk about that as well. I think that this kind of event is very useful, as well as the training courses for the general public. I believe so because there is knowledge about the things, but that's one thing. But putting that into action is another, especially in the international area. As I said earlier, the surveillance and monitoring system should be more strengthened and they should be more granularized. And if we can share the things that we learned from our surveillance system, that will be very helpful. As I also mentioned, we can have the basis of the data we already have gotten from other countries. On top of that, we can add our conditions after surveillance. That will be very helpful for making detailed plans for our company. Doing so, we can also share our experiences in making policies with other ASEAN countries. Therefore, we can strengthen our preparedness against this infectious disease by sharing our knowledge among ourselves. That will be the virtuous cycle about the enhancement of our systems against infectious disease. Therefore, I really value this kind of event today.
Professor Yang? So I am at a private university, so not as a representative of the government, but more of the sort of private sector. If I could share my thoughts, I talked about the importance of communication. So somebody has to quickly disclose information, and I think that's key to operating an information system, especially with regard to infectious diseases. It's sensitive information, and so you need to quickly share it with other people and other countries. Of course, this is not easy. But from that aspect, I believe that exchange of information must take place between countries, and those countries must build trust first. And of course, in terms of information exchange, there is information that is exchanged between the private sectors. And I actually implemented a small research project. But information exchange from the private sector, it's not easy, especially within the ASEAN countries. And of course, I'm sure that there are many reasons to this. There are regulations regarding information control. And because it is, ultimately information about patients, information protection, privacy protection, these act as an impediment or an obstacle to sharing information. So for information exchange and communication, I think there needs to be cooperation between countries, and the countries of ASEAN. There's a lot of people-to-people exchanges. And so not only between governments, but I think that people who are dealing with patients need to share more information. Of course, we just heard about a lot of the information that is produced in other countries, and we need to exchange a lot of those informations. And by exchanging and sharing information, I think we'll be able to get answers to our questions and actually exchange information that we need. So I think government-to-government cooperation is very important.
Next panelist is Dr. Nuruhashina Kahu. Could you suggest some ways?
Thank you. So, yeah, I would say that we need more dialogues and more collaboration in any sectors and any kind of cooperation. For example, I agree with Professor Yon Subten that about sharing data, knowledge, I think is very important. Yeah, we ASEAN maybe not many people who really into validation or verification of, I mean, passion about the data validation and verification. So I think we need help for that. And also, we need also, like for example, we have ASEAN Biodiversity Dashboard. This is a platform which is open for everyone, and we update the data on the zoonotic, for example, what we have related to the health, and then also other species in ASEAN Heritage Park. And I think that's also could be something that we could collaborate. I know in Korea I mean, you have a lot of expertise on technology and very advanced technology, so maybe we need help on that. And also, of course, research collaboration between university. For example, we have ASEAN University Network, so maybe we could also take a chance through that. And we have also ASEAN business and biodiversity initiatives. So that's related with the private sectors that Prof. John mentioned before. This could be attracted or a way that we could engage private sectors into the biodiversity and related to the health. Maybe that's my opinion. Thank you.
Thank you. Thank you very much for your good suggestion. And our next panelist is Mr. Michael Glenn. Please.
Thank you, Professor Kwan. So by looking at the ASEAN-Korea cooperations, just again want to emphasize that we have established ASEAN Republic of Korea cooperations within the ASEAN health sector. Recently, in the 9th of August, the health ministers of ASEAN member states and the Republic of Korea met in Vientiane, and they adopted a joint statement which can be the cornerstone, which can be the taking off point for future cooperations between ASEAN and Korea. They have agreed, for example, number one, they agreed on to explore a step-by-step approach to achieve the goal to improve the health level of ASEAN member states and improve the efficiency and utilizations of healthcare resources. They also agreed to promote more capacity building, and such as, for example, as we're talking about data, is on managing and analyzing health big data and information system. This is to ensure we will deliver a quality healthcare services as well as to improve patients' and population's health outcomes. The third one, we agreed, ASEAN and Korea agreed to support digital transformations of the healthcare sector through measures such as health facilities digitalizations, emergency medical efficiency, management of health and medical data, and advancing IT infrastructure while also ensuring the interoperability and data security. Another point that also we would like to share that has been also mentioned, that for having this kind of conduct of seminars or conferences, a regular exchanges between ASEAN member states and the Republic of Korea. So those are, among others, that has been agreed by the health ministers of ASEAN member states and the Republic of Korea, that can really be the anchor, or that can really be the entry points of cooperations between ASEAN and Korea in these specific issues to promote the and addressing the current and future public health threats, whether it's due to natural again or climate change. But again, to emphasize that through the continued collaborations between ASEAN and Korea and also the international partners, it will be complement the national, regional, and global agenda for a safer community. Thank you, Professor Kwan.
Thank you very much for your valuable suggestion. Our final panelist is Dr. Supawadi Pongsunbat. Please.
Thank you. So in my opinions, I have 3 points to talking about the global warming, and then we need some support from the Asian Secretariat or anything. The first thing is increase or strengthening the partnerships between public-private partnerships that I told you. Because in the government office, we have limited resources in terms of man, money, material, and management, as I told you. So the partner have a lot of resources, a lot of satellite, so we can do more early warning system, and then we can forecast for the dengue outbreak in the future, or something like that. The second one is encourage the regular border meeting. So in Thailand, let me talking about the Thailand. Thailand have sharing the border with northern part with Myanmar, western part also, and eastern part with the Lao PDR, and southern part with the Malaysia. So the vector or mosquito can fly from this side to the other side without any passport. They can fly at any time without a visa, unlimited also. So if we control in our country, but we cannot talking about the vector adaptation or something with the neighboring country, I think it's useless. So we need to have a regular border meetings in every side of the country. And the third one, we encourage to do something to reduce the breeding places, like the garbage separation or waste separation. The encouragement in every country to do like that. You can separate the hazardous waste and non-hazardous waste. And you can separate it into recycle, reuse, and reduce. So all of this can be a breeding places for mosquito in your country. So this is a kind of the reduction of the man-made breeding places, and also reduce the man-vector contact without using any chemicals, insecticides. Thank you so much.
Thank you very much. Your very practical suggestions. I think it's time to wrap up the discussion, but before we conclude the panel discussion, if there is anyone who want to share their ideas, I will take them now. Is there anyone who? Yes. Please identify yourself first.
It's not a recommendation. It's going to be the question to the Michael Glenn. And this is Grace from the KDCA. My question is regarding the ASEAN Diaspora Virtual Center. So, Michael Glenn, can you hear? Yeah, thank you. So, I am very glad that you just mentioned that like ABAC or MBT has a important role for the early earning. So my question is that has ASEAN Diaspora Biodiaspora Virtual Center conducted any assessment regarding the effectiveness of early warning or impact on policy making in Asian member country? This is my first question. And the second question is that, based upon your presentation, APID, the ASEAN Center for Public Health Emergency and Emerging Disease Center is going to be the setting next or the following year in Indonesia. And then when I see that the function for the Indonesia is really similar to the ASEAN Biodiaspora Virtual Center, and physically both of them is in the Indonesia. So do you have any plan to integrate or collaboration in terms of physically or functionally in that area? Yeah, over to you.
Okay, thanks, Grace from KDC. I think we met before. Thank you so much for that questions. Professor Kwan, if you allow me to answer directly.
Yes, please. Yeah.
Okay, first with regards to the utilization and maximizations of the ABVC, the ASEAN Biodiaspora Virtual Center. Just also to level the understanding expectations in terms of the operations of the ASEAN Biodiaspora Virtual Center. I think all of us here quite a lot hearing the ASEAN Biodiaspora Virtual Center operations and its product. They are amazingly producing a risk assessment, situational report, morbidity, mortality report. In fact, up to this point in time, October 2024, which the ABVC started its operation in 2020, they already produce more than 600 reports regularly. Okay. But we also need to emphasize and we also need to understand that ABVC actually is still a baby. They just born during the pandemic in 2020. There are still a lot of a development. There's still a lot of evolvement that the ABVC will be play its role in ASEAN. ABVC is really known for its robust disease surveillance and data visualization capability. As you mentioned, like what is the assessment of its usefulness, for example. In ASEAN, for example, most of the leader statement or a top level senior official statements that require a data from the region, they will always refer to the ASEAN Biodiaspora Virtual Center, the ABVC reports. So ABVC is now become one of the main data source for ASEAN and ASEAN member states in all policies development by the Ministry of Health. And I just want to also giving you some ideas that the interplay between ABVC that produce a risk assessment and also produce the providing member states with the data, and the ASEAN EOC network at the other side is providing the venue for rapid exchange of informations, is really giving the member states a well-informed and equipped for taking a proactive necessary steps in mitigating or managing the national outbreaks and also for response. So this interplay between the ASEAN EOC network and ABVC is really giving a guiding or a guided decision-making process, not only at the regional, but also national level. That's for the first questions. For the second questions with regards to the ABVC and ACFID, you're totally right. Thank you so much, Grace. It means that you're really following the development of the operationalizations of the ACFID. In fact, when ACFID is being developed, ACFID is not coming from scratch. So ACFID is really developed, built on the existing regional mechanism, regional entities, and regional initiatives that has been in place since 2014. One of it is ABVC. Definitely ABVC will be part of the ACFID Indonesia detection and risk assessment. How it will be formed, it can be in the forms of Center of Excellence for public health intelligence. It can be forms as one of the division or unit under the ACFID Indonesia. But you are totally right that ABVC is an instrumental mechanism that will be playing its role in ACFID detections and risk assessment. So Korea, that currently is supporting the ABVC operations, is also meaning that Korea is also supporting the operationalizations of ACFID detection and risk assessment. Hope it's clarified. Thank you, Professor Kwan. Thank you, Grace.
Thank you very much. Michael, you are the only person who have a chance to take a question and answer it. Thank you. As time is up, I will take just one more comments. Professor Kim? Oh, no? Okay. So it's time to conclude. Yeah. I think this discussion is very productive, and I hope it will enhance the cooperation between ASEAN and Korea. And especially I'd like to thank our panelists. Being both speaker and panelist is a very tough job. Yeah? Thank you very much. And I also thank the audience for participation. Thank you very much.
네, 훌륭한 진행으로 토론을 이끌어주신 고로장 교수님과
Thank you very much, all the panelists, as well as the moderator. And also, we have been benefited by all the insightful panelists' remarks. Thank you very much. Now, you may go back to your seats. 차장님께서 이끌어주신 이번 토론을 통해서 다양한 의견을
글로벌 건강 위협 대응이라는 주제로 함께 해주셨는데요.
So far, we have been having this general discussion regarding cooperation between ASEAN and Korea. Thank you very much for the insightful discussions. The strategies and challenges regarding the future collaboration on the infectious diseases with the climate change. By having this full session of having very productive discussions, we're now able to have one step further in getting more prepared for future responses. I would like to extend my gratitude to all the organizers as well as participants, including KDCA, KOHI, and ASEAN Secretariat. My thanks should go to all the speakers, panelists, as well as the audience from both online and offline. This concludes the 4th ASEAN-ROK International Conference on Response to Infectious Disease. Thank you very much for staying out until the end. Thank you.
네, 마지막으로 사용하실 리시버는 자리에 두고 나가 주시기 바라겠습니다. Please leave your receivers at your seats before you leave. And 네, 지스코 또 코아이 Core Personal Training 프로그램에 참가한 연수생과 또 이번 컨퍼런스 발표자 여러분께 저희 함께 단체 촬영 갖도록 하겠습니다. To those of you who have participated in the JISCO and COHI Core Personal Training program.